Good afternoon, everybody. I'm Mike Clegg, Dean of the school, and I'm here to welcome you to this symposium honoring Bob Lawrence. And I see there's a lot of I'm with Bobs here. Everybody knows who Bob is, and he needs no introduction. So that's why they asked me to introduce him. Um, and let's see if we can get some light here. So my background is I'm an epidemiologist and general internist, and in that setting, for decades, Bob Lawrence has been famous. And when I was a young general internist, participating in a group called Strepsum, bad acronym, but then changed the Society for General Internal Medicine. Bob was a leader there, and then he became the physician who led the campaign for evidence-based recommendations on clinical practice through the U.S. Preventive Health Services Task Force. So I knew of him for many years before I met him. And I met him here at Hopkins probably around 1998 or 1999, I think. And when I was asked to be the editor of the Johns Hopkins Family Health book. And so I contacted Al Summer to see who the representative would be from Johns Hopkins. And Bob had just arrived. And so he was picked for that reason, and also because he was somebody who really understood both clinical medicine and public health. And it was a great experience from day one, and we got to be fairly close because we spent hours and hours on conference calls every week with our editors and writers. So that's my personal experience with Bob. But there are many people here who know Bob well, and I'd like to acknowledge some special guests. And Len Rubenstein is here, I know, right? Who has Len, who has worked with Bob for many years. Jennifer Leaning, Lance Price, Fred Kirschenman, Grace Chan, Polly Walker is here, yeah, and Jim Kobe, Sid Mintz, and Sid Helene Lerner, and Winona Hodder. So welcome. So there's a short bio of Bob in the program, so you can read that for some details, but. The major part of today is going to hear reflections from Bob's friends and colleagues and his family members about Bob's career. I'm going to just share a little bit of the highlights about his accomplishments. So Bob was conducting epidemiological studies in Central and South America during the late 1960s when he became acutely aware of the social determinants of health, of the complex interplay between politics and economic repression and health. And after returning in 1983 from a human rights mission to El Salvador that was sponsored by the IOM and the National Academy of Sciences, he joined a small delegation for an investigation in the Philippines. He then was a founding member of Physicians for Human Rights, another organization that was famous to every clinician in the room. He helped establish that in 1986, and he served two terms as president of its board of directors. First from 1998 to 2003, and again from 2007 to 2013. And he was able to get me to donate to that organization, which is, not easy to do. And he has been a leader, so he was a leader in clinical medicine. He was chair of medicine for many years. At Cambridge Hospital, and then a leader in research, but also a leader in being a conscience for physicians and dealing with human rights. And I often thought when I came to the school as dean and would interact with Bob in his role as associate dean for practice and training, that he in many ways was the conscience of the school, that he was always bringing up the important issues that were too painful to look at directly or so difficult that you didn't want to grapple with them. And Bob never let us get away with that. He's done human rights investigations and been involved with other human rights groups around the world. He also had an interest from early on in his career into reaching out from the hospitalized setting, which is where medicine was, to the community. And from 1970 to 1974, he was at UNC at Chapel Hill, where he helped develop a primary healthcare system funded by the Office of Economic Opportunity. It was really way ahead of its time. It was a link with a geographic and area and providing care for them. And others may say more, so I won't say. But it was there I know that he he interacted with a young child in the neighborhood who's now a faculty member at the school, a full professor, and maybe that will come up during the discussion today. And then he went to Harvard, where he had gone to medical school, and was appointed as the first director of the Division of Primary Care, and then became the Charles S. Davidson Associate Professor of Medicine and Chief of Medicine at Cambridge Hospital until 1991. And he was a renowned mentor, still is a renowned mentor, but a renowned mentor to clinicians and residents. He left there to go to the Rockefeller Foundation. He was at Rockefeller for 4 years, from 1991 to 1995, and was director of the Health Sciences Division. And I think it was there where he really started to work on the issue of agriculture and understand the influence of agriculture on health. Al Sommer recruited him, and Al is here. Al, raise your hand so everybody. And one of the many things that Al did was to recruit Bob away from the Rockefeller Foundation back to the school. And he served as Associate Dean for Professional Education and Programs in the school until 2006. Bob is a humble person. Everybody who knows him, that he's a gentle person, humble, but there's steel underneath. He's committed himself to human rights, to the importance of primary health care, to great patient care when he was a clinician, to preventive medicine, and access to care for underserved populations. And now, more recently, to illuminating the influence of agricultural farming and our industrial food systems' impact on the environment and public health. And so to talk further, I'd like to invite our chair of environmental health sciences, Dr. Marcia Wills-Karp. Marcia.
There's a phone that's on here. Is it supposed to be? Okay, so I won't bother it. All right. Well, thank you, Mike, and welcome to all of our faculty, staff, students, alumni, and distinguished guests. It's our pleasure to have you all here today to share in this special day of honoring Dr. Bob Lawrence. I'd especially like to thank those who had to travel from afar to be here with us today. We know you all are busy, and we really appreciate you coming out to support Bob. As you'll hear over the course of the afternoon, Bob is a visionary leader in public health and an important mentor to many in this room, and many that couldn't make it here today. He served in many roles in the school, as Mike was just telling you. He was first recruited here by Al Sommer to be Associate Dean for Professional Education and Programs, and he was only in that position for a year when Al, I'm told, tapped him to put together a concept paper. This may not be all the correct details, so you can correct me later. Yeah. Okay, right. Good story. Right, good story. Tapped him to put together a concept paper for an institute or center that would be focused on animal rights in food production system. And out of that, he had such a visionary concept that he was then tapped to be the founding director with Polly Walker, Grace Bush, others that had a role in formulating what we now know as the Center for a Livable Future. The CLF, as we call it, has made great strides over this number of years. It started out with a very small staff, and it's now grown to quite some size. But the most important thing is the influence of the center. The influence has been tremendous. The current members of the center have a great influence over general public's opinions about food production, diet, and its role in public health. In addition, they've had a great role or a great influence on policymakers in this area. And just over the last year or so, that work has really come to bear in changes in some of the policies around antibiotic use in farming industry and others. And we're really proud of CLF for the work that they're doing and the fact that it's all based on evidence and scientific knowledge. And they're providing this to the community and to policymakers to move this forward. So recently their work has informed aspects of the Farm Bill, and it's brought to the forefront the impact of food production on human health. The center also plays a very important role in the school and in the university in terms of providing opportunities to do research for students in the food systems, and through a fellowship program that they fund a number of students from all different departments around the school. And this is a very important effort and important to students' education and to the school. In 2006, the Department of Environmental Health Sciences was very delighted to welcome Bob to our department as a full-time member. And over the years that I've been here, the last two, I've had the privilege to work with Bob directly. And in my opinion, in my interactions with him, he's a kind, compassionate individual who can impart sage advice, but he does it with a twist of humor. And it's a pleasure to work with Bob in many different committees and activities of the department. So today's symposium, let's see if I've just started to wear these little reading glasses, and I can't quite get used to actually putting them on when I need them, so excuse me here. Today's symposium will highlight some of the key aspects of Bob's career and his contributions to public health. The program will include presentations by several colleagues regarding two of Bob's most important passions. I know he has many others, but the symposium will focus on two of these. And one is health and human rights, and the public health relationship with the food system. The theme of the symposium, for those who might not be aware, Beyond Tilting at Windmills, is a reference to Miguel de Cervantes' 17th century masterpiece, Don Quixote. It tells the story of a mad knight. We're not saying you're mad, Bob. But Don Quixote was motivated by the central principle that individuals can right societal wrongs. The character of Don Quixote has come to us to represent over the years, be associated with idealism and nobility. And these are all qualities which we admire in Bob. However, Bob has gone beyond tilting at the windmills, as Don Quixote did, to bring evidence-based science to the advocacy work of the center, and to bring about a new framework for thinking about public health in relationship to human rights and food systems. Your being here today is most appreciated by all of us who've been involved in putting this symposium together, and we know it means a great deal to Bob and his family. So let's get started with our first session, which is the emergence of human rights as a framework for public health. It's to be hosted by Dr. Len Rubenstein. He's the director of the Program on Human Rights, Health, and Conflict here at the Bloomberg School of Public Health. He's a graduate of the Harvard Law School, and he's dedicated his career to many human rights law and public health policy issues. He's led many national public health initiatives, particularly those focused on mental health. He served 15 years at the Judge David Baselton Center for Mental Health Law. He came to Bloomberg after serving as the Jennings Randolph Senior Fellow at the United States Institute of Peace. And since coming to Bloomberg, he has founded and chairs the Safeguarding Health in Conflict Coalition that promotes the security of health workers and services threatened by war or civil unrest, which, if you listen to the news lately, I'm sure that he's been quite busy, and these are really relevant issues of our time. So I'd like to welcome Dr. Let's see. Nice. Oops. Now I've got to take these off so I can see. Do we need to get, do you have a presentation?
Not yet.
Okay. All right.
Thank you very much, Marcia, and it really is such an honor and a privilege to be here. Bob has been an investigator when I was at Physicians for Human Rights. He was a mentor. He was my boss when he was board chair and I was director. Now he's a colleague here at Hopkins, and he's a friend. It's really special, too, because it's impossible to underestimate the influence he's had in bringing human rights to the field of public health. Today, we take it as truism that human rights is part of the fabric of public health. But if you go back to when Bob started this and just taking the AIDS epidemic, when Jonathan Mann said the origins and causes and responses to the epidemic had to take into account oppression and other social determinants of health, it was a controversial statement. But today, whether it's HIV/AIDS or women's health or any aspects of public health, human rights is considered part of the fabric. Well, Bob had an enormous role in making that happen. Whenever we respond to public health crises, including Ebola, we can't look at it without taking into account human rights. So he's been a force in the field, and not just through his intellect, but through groundbreaking investigations all over the world, from South Africa to El Salvador to Guatemala to Philippines. And in this part of the symposium, we decided to focus on 3 areas where Bob has had a uniquely important role. We could choose so many. In fact, it was very hard to narrow it to 3. We could have chosen so many. But we chose 3. And for the first of the presentations, we were very fortunate to have, by phone, unfortunately, he couldn't be here. Jack, I hope you can hear me.
Yes, I can.
And Jack Geiger will be giving the first talk on race and health, from apartheid medicine to racial disparities in the United States. As you could see in your program, Dr. Geiger has enormous accomplishments, but he's such a modest man that the list in the program doesn't begin to show his towering role in this field. He not only was a founder of Physicians for Social Responsibility and Physicians for Human Rights, he not only started the first community health centers in the United States, which are so much a fabric of our health system for the poor. Here's what else he did. He was fighting apartheid in South Africa in the 1940s, and later was a major founder and leader of the Committee for Health in South Africa. As a medical student, he led demonstrations and other forms of advocacy to desegregate hospitals in Chicago that were affiliated with the University of Chicago, and succeeded. In the civil rights movement in the United States, he was with the Medical Committee for Human Rights, which provided not only health care for people in Mississippi, but really brought to fore and other parts of the South. But he brought to the fore the fact that the racism of the country was reflected in the health system. He's engaged in human rights investigations all around the world, and he also initiated one of the most successful minority recruitment programs for medical school in the country at the City University of New York. Perhaps maybe you can sum it up by saying he has not 1 but 2 programs named after him. A program at George Washington School of Public Health, the Geiger-Gibson program on community health policy, and the Congressional Black Caucus created a fellowship in his name to encourage minority scholars to work in the field of racial disparities in health. So we're very fortunate to have Jack Geiger with us, and what I'm going to do is I'm going to point the microphone at the microphone at the phone, and then we all pray. So,
Can I do a 1, 2, 3, 4 testing to see if this is working?
Can you hear him? All right, so I will sit down. Take it away, Jack.
Well, thank you. I'm so sorry that I can't be there in person, and even more regretful that somehow the Skype connections on which we were counting didn't work. But I'm glad that I'm going to be able to be a part of the celebration of this phenomenal career and this phenomenal friend, person, colleague, and leader by the name of Bob Lawrence. You beginnings, who famously remarked that one should never underestimate the capacity of a small group of determined people to change the world. And I think PHR, like other organizations of this type, has indeed changed the world, and certainly changed the world of human rights. And all this began with 7 people sitting in a back garden in a suburban home outside of Boston and Newton. 7 people. Jonathan Fine, a physician who had previously launched something called the American Committee for Human Rights, not specifically focused on physicians or medicine and human rights, but including some of that. Bob Lawrence, John Major, surgeon at the Mass General Hospital, Philip Alston, a lawyer from Australia originally and subsequently, myself, Carola Eisenberg, a psychiatrist at Harvard Medical School, and Jane Shaler, the chief of pediatrics at Tufts Medical School in Boston, engaged in conversation about Jonathan's proposal that some organization be formed, perhaps medical or medically oriented, that could subsume and take over and continue the work of the American Committee for Human Rights. And out of that, several hours of discussion in which Bob made major contributions, have emerged the basic defining concept of Physicians for Human Rights and the determination to create such an organization, to bring the skills of medicine and the health professions and its allied sciences to the investigation and documentation of human rights abuses, and with particular reference to medical care and the liberties of those professions to do that work, and to add those sciences to the advocacy efforts for the protection of human rights. Now, all of that noble-sounding talk translated into a 2-office headquarters, as I remember, at the end of one of Boston's subway lines in suburban Watertown, where we met frequently, I think, with perhaps one staff member, gathering for pizza on Thursday nights every week, and sometimes more often than that, to shape policy, to begin our work, to draw up the rules to create the organization, and indeed to begin the work. And the work was going to involve missions, and Bob led the first mission, I believe, of Physicians for Human Rights to Argentina, to help protect the integrity of the Argentine Academy of Medicine, the freedom of physicians from in their professional activities and organization from oppressive state control and limitation, the ability of physicians to treat under their own ethical obligations people without regard to their political affiliation or their opposition to the government, all of the things that the government then in power in Argentina were opposed to. And the appearance and activity of losing his temper. And we really do miss Skype, but I'll do my best to imitate it audibly and describe it. First of all, he raised his voice. His jaw. Thirdly, he gritted his teeth. And with an elevated voice, I think in response to something Jonathan Fine had said about the board's power to control him as the chief of missions, whatever was under discussion, and Bob, with raised voice, gritted teeth, clenched jaw, said that was not, I think, a very helpful contribution. That's Bob Lawrence's version of a volcanic explosion of temper. And it's one of the characteristics that all of us came to rely on. It took also, in addition to calm and thoughtfulness and reflection, an extraordinary degree of organizational skill to serve as president with all those characteristics that I tried to describe during crucial periods of organizational growth as PHR grew and expanded its range of activities and expanded its membership and expanded its budget, and ultimately in more recent years made the move in the main from Cambridge in Massachusetts after all these years to New York, where it is continuing to grow and expand, and during which time Bob served as president and then subsequently as an important board member. But he brought to PHR, and I'm sure this is true of the other activities that you will hear about, I know Jennifer Leaning will describe some of them, he brought to each of these activities the kind of range of experience, the discipline, and the information that came from his experience in all these other domains. And that truly made him, in my view certainly, and I suspect in all of your views, a renaissance man of the human rights movement, because he manifested himself in so many different areas and so many different capacities. I'm going to stop with that and hope that there are comments or questions or additions from the audience of experiences that they have doubtless had with Bob that reflected on this extraordinary capacity and this extraordinary contribution.
Thank you very, very much, Jack. Our next speaker is Dr. Jennifer Leaning, also a towering figure in this field. She is currently the director of the Harvard Francois Xavier Barnou's Center for Health and Human Rights at Harvard and the FXB Professor of Health and Human Rights. She's also directed the Harvard Humanitarian Institute. And on a very personal level, I worked with Jennifer for many, many years because she was really the premier investigator for Physicians for Human Rights when I was director. Whenever we needed someone with exquisitely honed public health and medical skills, and also the ability to work in incredibly difficult environments, we sent Jennifer. So we sent her to have a look at Taliban prisoners in Afghanistan right after 2000. The war started after September 11, 2001. We sent her to Kosovo in the midst of Serb atrocities. We sent her to Darfur when the place was ablaze. We sent her to Rwanda right after the genocide when most of the world didn't know that violence was continuing. And she always came back with incredible insights and brought those insights to the public, to members of Congress, and to the public health and medical community. And there's another dimension of her work which bears mentioning, which is the people she worked with in these areas are so incredibly grateful. I had the privilege of going to Kosovo after she had been there, and the outpouring of thanks that the Kosovo Albanian medical community had for Jennifer, which persists to this day, is remarkable. And so we have someone with incredible academic credentials and skills, compassion, and human rights investigatory skills, which are unmatched. So it's a pleasure to welcome Jennifer Leaning.
Thank you. It's a real pleasure to be here. I would like to say it's an honor to be part of the program, honoring you, Bob. You have been a leader and a mentor to me, and it's wonderful to be part of this gathering that is paying attention to every aspect of your professional life and probably some aspects of your family life as well. So thank you for this opportunity. Thank you for the organizers. I now am in a situation where I need to get into a PowerPoint, and I'm not quite sure how to do it. I'm sorry. Once that happens, I can proceed.
Let's get you right here. That's the beginning.
Okay.
I'll put you up to your slide.
Great. Okay, thank you. So my task is to talk a bit about the ways in which the human rights position and the role of physicians has evolved over the last years. I take my starting point in a slightly idiosyncratic way in the first part of the 20th century, move more abundantly into the post-World War II era, look at primarily domestic discussions in human rights, but there are a number of times when the domestic human rights movement that has involved physicians has interacted with very powerful international human rights situations, so I'll talk about that as well. And I hope you keep in mind that as I walk through this, that there is a way in which we can say that almost every one of the organizations that I am talking about and of the rights-based fights that I am going to be referencing, Bob Lawrence has been engaged as either a leader, a member, or a contributor, either financially or in terms of his voice and teaching. I might say the same for Jack Geiger. And Jack, it's great to hear your voice, and I think people got a sense of you as well, even though you weren't here in person. So in this talk, I'd like to make some distinctions. I won't dwell on them because that is actually a course, but between medical ethics, social justice, and anti-war or peace activism and human rights. Just briefly, because I think it is important to recognize that we're speaking within a disciplinary trajectory. Secondly, although all of you are health workers or physicians or people in training in the health field, I would like to point out the stance that physicians and health workers have, which creates the aspects of a profile that make it useful, effective, and often highly sought to engage in areas of distress, whether it's domestic or international, whether it's peace or war. And go briefly through the history of some of the major fights we've had, and then end with some key points. So from the standpoint of distinctions, one could argue with this if this were a classroom, but basically medical ethics deals with a physician-patient relationship, and it has a very long history, going back to Hippocrates and Maimonides and a number of medieval scholars. It's a wonderful topic. It overlaps with human rights, but it's really quite separate with a different history and a different focus, and actually with different concerns in mind. Social justice deals with problems of politics, poverty, charity, fairness, and accompaniment, and has brought many people into the human rights movement. The concerns of social justice go way back, pre-Victorian era. I mean, you can see this in the charitable foundations, in the religious orders, again, going back centuries. This problem of how does society deal with people who are treated unfairly or deal with suffering is a very, very long-standing one. But again, human rights has its particular rules and approach that differentiates it quite sharply from movements of social justice. As I say, they overlap, and we welcome all comers when we are involved in human rights fights. Peace or anti-war activism, and all of us have been involved in this, that is the speakers and the man who's being honored. But I would say that it is very much grounded in a particular war or a stance towards war in general, and it has a range of infusions of thought and emotion that contribute to one person or one organization's activism, but opposition to cruelty, opposition to killing, the rationale for war being very contested, and a search for other options for resolving conflict at the group or nation-state level. Human rights is based in international treaties and documents. Its historical roots are in political philosophy, and it has a very rich and growing legal tradition in the light of these documents and covenants. And this is where I'd like to make a few points as we come into the history. The stance, that is where we are actually standing, what we can say as physicians and health workers we are privileged to see, has a number of elements. One is the ways in which we are trained. We are brought up in medical school and perhaps in pre-med training, and then certainly throughout our careers to reason on the basis of what we can find empirically. We are basically interested in what the world tells us. We, however, have means of assessment that are based on methods and mechanisms that have evolved over time. They're very logical. They're based in an understanding of science. To the extent that the science is messy, then the methods are not very logical. But there is behind it a certain scientific integrity in the quest for the best answer based on what we can find. And our approach is founded in medical ethics and compassion. Now, that isn't necessarily where students enter, where they would say they were standing from, but by the time they finish a good medical school, they understand that. And for sure, by the time they finish a good training program, whether you're a nurse, a healthcare worker, a social worker with a health bent, you have been groomed in medical ethics and compassion. We also have, as health workers, a special privilege, which allows us a way of being in the world that is quite wonderful, but also has a number of responsibilities attached to it. We are respected in society to a large extent. This is across the world, not just the United States. We have unique access to individuals and groups in terms of their thoughts, their feelings, their suffering, and their most private concerns. And we have a recognition in the world that has been granted to us because we so far have behaved according to medical ethics and compassion in large measure. We're recognized as having an intent and a capacity to relieve suffering. We are viewed as objective, and that's partly out of medical ethics, but I'm also going to say this plays a very big role in our effectiveness in human rights work. And we have many ways in which we can be employed. The life of a healthcare worker is usually diverse in terms of places, roles, responsibilities, countries even. It's really an enormous privilege. And then in practice, we have become better, more disciplined, more seasoned in the ways I've enumerated here. Unless we hold ourselves up in a lab, we are usually exposed to people from all walks of life. We are highly disciplined, and it's beaten into us to work hard and stay focused on the task. That can be brutal, and it can be actually at the expense of compassion and medical ethics. This is another part where we could have a course on this. We are trained to be skilled in connecting with people, and yet also we are skilled in maintaining a certain important social distance. And we are required to take care of all who seek help. This is a problem in healthcare. In other words, if you stand in a facility and you take care of people coming towards you, or do you look outside the facility and say, what is happening in the community? And the person we're honoring today took that latter course, and that's one of the reasons he is so treasured among us. And then, as a physician, you have opportunity. I've mentioned some of the aspects of this. You can choose your roles, you can choose your employment in general. You have a very adaptable skill set. This comes in when we're talking about human rights work. And you have a possibility to engage, because of your skills, your privilege, your stance, in social, economic, and political issues of our time. So I will just walk through some of the roles that physicians have played in the 20th century. You can go back to many of the social justice activities that occurred in centuries past. But here's what I would just like to draw your attention to: what health workers and physicians, what they have done in terms of advancing human rights. Okay, I don't have names here. There could be names. That would be a much longer essay. But here we have their writers. Think the New Yorker. They are individuals in they're individuals in highly visible places. Think the World Bank or the International Committee of the Red Cross. They are clinicians within group practices or in teams that take care of disadvantaged or oppressed populations. They're investigators, domestic or international. They're usually in small groups, teams of 2 at least, and they are there looking at sharp-edged issues that have arisen and are often called in from the outside because of the objectivity and the freedom that comes from not being a member of the nation state that is often part of the oppressor. They're analysts of consequences of violations, and the analysis could be philosophical, psychological, medical, social, political, but they do it from the position of empiricism and logic and disciplined reasoning, and to some extent objectivity. The facts, please. They are researchers into medical and psychosocial harms. They're journalists. Think Sherry Fink, think Elizabeth Rosenthal. They're journalists that really manage to uncover important issues in a fluent and often beautifully written and incisive way to get the word out. They can be founders or very active members of medical professional societies with human rights as the main focus. They can be active members of human rights organizations such as Amnesty International or the ACLU. They can be major donors or members of board of directors of these organizations. And then they can be forming groups that advocate for human rights within their own professional medical or healthcare societies. This may not be an exhaustive list, but as I was going through a lot of people I knew and people that were famous, this is what came up. So they're also politicians in elected office. In the United States, they've had a sprinkled career. We could go into that one way or the other, but there are definitely politicians who are physicians. They're academics with a very scholarly focus, and that certainly defines what our colleague Bob Lawrence is. They can be leaders or activists or practitioners with international relief organizations. And often they work with legal teams in many of these investigations or advocacy efforts because they confront the law. Coming back to this point, human rights is about the law. It's also about a stance and a history. So if we take what was going on pre-World War II and look at the campaigns for the abolition of the slave trade, the women's suffrage, and end of child labor throughout the 19th and early 20th centuries, most of this, I'm talking now domestic U.S., were based on principles in the U.S. Bill of Rights, going back to the framework and our Constitution. Some of it was based on events that were happening in the UK that also, or in France, that also were based on bills of rights. Then, if you look at what happened during the major events of the 19th and early 20th century, you can see that this language of rights was accelerated by the U.S. Civil War, emancipation, and universal male suffrage that was granted. But what about African Americans and blacks, and what about women? There was a sharp edge there in the contrast, accelerated real human rights activism. Then you had democratic political reforms throughout the century in U.S. and Europe, and then rising social consciousness in the late 19th century and throughout the mid-20th century about graft, crony capitalism, and an expanding labor movement. This is all pre-World War II. Children in textile mills were a major focus of organization in the 1900s. The Depression galvanized a sense of the poverty and the desperation of large swaths of our population. And in this quote, it says, I don't know if you can read it, this old couple says, I think it's only right that the government ought to be run with people like us in mind. That captures, the obligations of the state. And this incredibly good book, which most of you over 16 will have seen, you have seen Their Faces, 1937, is the basic text and picture of what we have to go by. Then, post-World War II, we have the Universal Declaration of Human Rights. All human beings are born free and equal in dignity and rights. It is a gorgeous document, written so it could be translated into all the languages of the world. Eleanor Roosevelt was in charge of it. It is the founding documents for our human rights work. Then we have the history of the major treaties post-World War II, all arising out of a sense of coming together and horror at what the world and its nation states had put its people through. Most of the edifice arose in the first 10 to 15 years after World War II. Here you have the major documents of human rights that talk to, look at that language. So much of that is medical ethics. So much of that comes out of political philosophy, dignity, autonomy, equity, vulnerability, voice, accountability, and non-discrimination. Yet each of those has major responsibilities and edges to it that people in human rights have learned to understand and work with. Then in international humanitarian law, again, like Geneva Conventions, these galvanized after World War II with a very powerful set of pronouncements on distinction between civilians and combatants in war. International refugee law, the entire structure and framework for forced migration and asylum, again, came out of World War II. So if you look at the major events of what we have been dealing with, we are actually working within that moral and legal edifice. And I want to go to a picture here. This is not the way to distribute food. There are people from international development that can tell you, but from a human rights standpoint, this is a violation of dignity and equity. And this is how you should read this photograph. You should read this photograph as well, people out in the sun. They're Africans, yes. Africans don't like to be out in the hot sun for 12 hours a day either. You find them under a tree. This is forced food distribution, again, an affront to dignity and affront to their well-being. So the major issues that we've been working with since World War II have been free speech, basically dealing with the anti-communist scare. Welsh McCarthy hearings in 1954, the first time major Senate hearings were on the television. We've been dealing with civil rights. Jack was there at virtually every aspect of it, and I know Bob was involved as well. We have been dealing with major other issues in the post-World War II environment: child rights, cultural rights, immigration rights, gay rights, disability rights, animal rights, climate change. Again, you can slot Bob's contributions, and many of you in the room have been involved or are now involved in these rights movements. We still have major problems internationally with child labor. We have some in the US, but now it is moved to be an international concern. Of international concern has been all the work of torture, asylum, and detention and protesting prison conditions. Again, big role of Physicians for Human Rights and of the Lawyers Committee. The work against nuclear war, and I said anti-war activism was not a human rights issue, but nuclear war threatens life itself and threatens the future of the world. It's a right-based argument if you look back at how we framed it during the anti-war work that we did at that point. Humanitarian crises are all about the oppression of civilians. And if you think about what we are now facing in the massive wars in the Mideast and the Syrian crisis, a particularly oppressed population are the Palestinian refugees in Syria, Lebanon, and Jordan. They're refugees now twice because they have hailed once from the land of Israel and now are in these places, and then the war is displacing them again. So if you look at the history of the work of human rights organizations and just scan these dates, these are ones that have had significant physician leadership. They started in 1947 with the World Medical Association, and they zoom right along till 1986 with Physicians for Human Rights. Those with great significant physician engagement, you can see here, starting with the American Civil Liberties Union in 1920, but almost all of the others are post-World War II. There is this massive galvanization of energy work and alliance in the decades since that war. So I'd like to leave you with these major points: that the organized social activism of physicians and other healthcare workers is a post-World War II phenomenon in general. That they've looked at economic, social, and cultural rights as much as civil and political rights, as you might think: the right to health, the right to food, the right to work, the right of home. These are all realms that the United States has not formally signed into treaty law, but physicians and healthcare workers have been very active in this realm. Human rights now are powerful arguments for social change, and physicians and healthcare workers, especially in their mobilizing groups, have proved to be visionary and effective agents in this process. Thank you.
I'll need a little help here with with the computer. But I want to turn now to one area of programmatic area in human rights, substantive area of human rights, where Bob has had particularly important influence. Even that was a very difficult choice because there are many fields. Here we are.
Here we are.
But this particular one is so relevant today because the connection between health systems and the protection of human rights, particularly violence against health and health systems, is so before us. And what you see here is a famous picture of the Battle of Solferino, 1859. And the reason that battle was so important, among other reasons, is that it led to the founding of the Red Cross. And you see the wounded and sick on the battlefield. And it was a result of this battle that the Geneva Conventions, the first Geneva Convention in the 1860s, was ratified. And from that time and through all iterations of the Geneva Conventions through the 1970s, the protection of health care, the protection of health workers, the protection of the wounded and sick has been central. But for about 120 years after the first Geneva Convention, these provisions had almost no influence. No one paid attention. It was really only in the late 1970s and 1980s that they started getting attention. And there, who did they get attention from? One of the wonderful things about this presentation is I managed to dig up this picture of Bob Lawrence in El Salvador, one of the first investigations of disappearances of health workers. They did a tough investigation. They found 16 health workers had disappeared and determined that they were singled out for harassment and arrest because of their ethic of impartiality, the very ethic that was central to Jennifer's presentation. And in fact, that had repercussions that it meant that health workers were understandably reluctant to treat patients, especially the poor who were victimized in El Salvador. And these individual cases which led to other investigations in Chile and the Philippines, and actually have continued through the decades. But they started revealing that there weren't just individual attacks on health workers, there were systemic effects. And under Bob's leadership, we started seeing documentation of systematic effects. In Kosovo, based on population-based studies at Physicians for Human Rights, we determined that more than 100 health facilities were destroyed. They also prosecuted dozens of physicians for providing health care to the opposition. In Chechnya, you see 24 hospitals and other facilities were bombed by Russian forces. In Iraq, more recently, we know that doctors were targeted, and about half of the 30,000 plus doctors left Iraq as a result. So we start seeing these systematic effects. So all of a sudden you see individual human rights violations having population-based impacts, and you have to link human rights to public health. Well, this is the most egregious case I'm aware of, and it's going on as we speak in Syria, where the government has systematically bombed and shelled hospitals as well as other civilian objects, such that over 50% of the hospitals have been damaged and a third aren't functioning. Doctors are arrested in huge numbers. They've been killed, all because the provision of health care to a member of the opposition in Syria is a criminal act. So here we have oppression, we have violence, we have public health, we have human rights. We also have not just these instances of systematic attacks, but in chronic conflicts that go on for decades. We have persistent interference with healthcare in the West Bank and Gaza over the last 20 years, since the first Intifada, hundreds and hundreds of cases of damage to health facilities and ambulances, thousands of cases of people harmed by checkpoint delays. In Burma, over 50 years, of conflict in the East, health workers were basically not permitted to operate. They had to operate illegally. They were arrested. As a result, healthcare to these villagers was completely obstructed. Then we have situations not of conflict, where the Geneva Conventions don't apply, but what I call political volatility. Here are two cases. In Turkey, a year or two ago, there were demonstrations, the Gezi Park demonstration, and 8,000 people were injured, and doctors went to treat them. But those doctors were now being punished by the government because they were providing emergency care to the demonstrators. The parliament turned around and enacted a law that's in effect now that says that providing emergency care to someone in these circumstances without prior authorization is a criminal act. So the idea of emergency care and prior authorization is kind of a non sequitur, but that's now the law. In Bahrain, doctors have been tortured and arrested because of their involvement in treating demonstrators at the main hospital and at other sites during the Arab Spring demonstrations. So we have this kind of pervasive problem, and you can see this is from a report last May, just showing you how in 1 year, this is for the year 2013, where these kinds of attacks have taken place. And in a study by the International Red Cross in places where it works, it found 1,800 violent incidents in a single year. And contrary to what we think, that it's all aid workers who were victims, 78% of the victims were local health workers, not members of international organizations. And so what are the public health impacts? Just to very, very briefly, this was one study from Sri Lanka, where you can see that when the war started winding down around 1996, the Civil War, it wound back up later, but there was a lull. And you can see in the number of physicians started in 1981, the same basically all over. And the dark black line is the northern province where there was fighting. It went down during the war, understandably, but then when the war kind of winds up, it doesn't catch back up. It doesn't catch back up. I'm going to have to put this somewhere else. Similarly, if you look at maternal mortality, you see the same issue, where in the northern province, it starts out the same. It's actually lower, and then it juts right up, and then it never catches up to the other parts of the country. And we know from today what the impacts are. We know that in Liberia and Sierra Leone, where Ebola is basically out of control because they have such ineffective health system. Well, what's the impact of violence on that health system? Liberia had a civil war that ended in 2003, which by these standards, not that very long ago. 82% of the public health facilities were non-functional in 2003 due to looting or destruction. So it's taken a long time. We're not back. They've had a health reconstruction project there for years, starting in about 2006, but it couldn't catch up. Even worse were the human resources, where 90% of the physicians left, and there were similar figures for nurses, and the human resources are still completely inadequate. So when people talk about the inadequacy of the health systems in these Ebola-affected countries, we have to take into account the violence. And since 2001, we've had special vulnerabilities because of counterterrorism. Healthcare is not only criminalized to members of the opposition in the places I mentioned, like Turkey, like Syria, but our own government criminalizes healthcare to terrorists. And we know what the mix of terrorism and counterterrorism has had a devastating impact on polio vaccinations in Afghanistan. We know about the fake vaccination campaign conducted by the CIA, where Mike Clegg had such a major role in stopping. But as a result, we think, we can't prove this, but 60 vaccinators have been killed since the revelation of this fake vaccination campaign. We also have seen the use of health interventions in counterinsurgency. So over the years, the response to these kinds of attacks have mostly come from extraordinary leadership in the humanitarian community, from groups from MSF to all the other ICRC. And they have a particular approach, which is important and valuable. They gather data to inform their own protection strategies. They do studies, qualitative studies, to understand particular contexts and motives. They train and interact with the military police. They negotiate with potential perpetrators, and they insist on respect for humanitarian values. And that's all well and good, but it's not enough. It's just not enough. If starting at the bottom, maybe, that was Margaret Chan in the italics. That was a speech she gave 2 weeks ago, in which she said the sense of outrage has been muted. The fact that these attacks have become so widespread must not be tolerated as the new normal. Well, the flip side of that is they are being tolerated as the new normal, and what can we do? And this brings us back to Bob Lawrence and human rights, because one of the insights of human rights, and going back to the work in El Salvador, is that strategies for protecting aid workers may not be effective for protecting indigenous health workers. Moreover, there are limitations to international humanitarian law. It doesn't apply in certain circumstances if there's not an armed conflict. Also, it may not apply very robustly in situations of insecurity, short of war. It doesn't have the kind of robust mechanisms and machinery of accountability that the human rights law regime has. Humanitarian data collection, which I mentioned, is usually private and insular because groups feel it's important not to share their data for all kinds of valid and sometimes self-protective reasons. And it's not based on exerting political pressure. So that's why we need to go with the human rights response. And those 30-year-old ago missions to El Salvador and elsewhere were really about raising the visibility in public arenas to put pressure to end violations. It's to raise the cost of a human rights violation. And what do? There are 4 ways now we try to use human rights approaches with respect to this or any other human rights problem. The first is to reinforce and expand norms. The second is ongoing monitoring, surveillance, and public reporting. The third is accountability. And the fourth, most controversially, is sometimes to intervene directly in various ways, what we call the responsibility to protect. Let me just go briefly through those. Where do we stand? Well, human rights law and norms for a long time were held not to apply to this problem because it wasn't as explicit as humanitarian law. So when Bob was out there wasn't as broad a recognition that human rights law even applied. But in recent years, there has been scholarship that showed its applicability. And last year, for the first time, an official of the UN's human rights system issued an opinion that says, yes, human rights applies in very broad ways to situations of conflict or political volatility. And as we speak now, there's an effort for the UN General Assembly to pass a resolution basically affirming what the Special Rapporteur said, and that should come up in the next month or two. Second, monitoring, surveillance, and public reporting. I put it in bold because what Bob did started a tradition of dozens and dozens of human rights reports on attacks, and that were incredibly important, and we wouldn't be where we are today were it not for that reporting. But it's still not sufficient. We need a global system. We need UN agencies with responsibility for human rights or for global health or both or protection of children to be engaged in monitoring, surveillance, and reporting. In 2012, WHO was charged by the World Health Assembly with gathering data systematically, still to be implemented, but now we have a requirement. There is an agent of a creation of the Security Council called the Special Representative on Children in Armed Conflict, which is now charged with individual case investigations and has an accountability process for the Security Council, so we might get somewhere. And there can be integration of this work in the work of routine global human rights institutions, which are everywhere. They're regional institutions, they're institutions in Geneva, and they don't always work. You know, in human rights, we fail often, probably much more than we succeed. But still, there's the possibility of using the pressure through this machinery. And the protection of health needs to be integrated. And there are some terrific new tools, or I say modestly. On the left is a tool we've developed here at the Bloomberg School, an individual case reporting tool that could be used on a mobile device for when there's an incident. And on the right is a map, another innovation by Physicians for Human Rights recently, to track attacks in Syria. Accountability, as I mentioned, is tough, but we need to develop those to stigmatize perpetrators. And there are formal mechanisms which have been used, as I mentioned, within the human rights machinery that now can be applied to this problem. And the Security Council procedure has a listing procedure which, before the whole council and the world says you are a persistent violator, you must develop a plan for compliance. It works about 20% of the time, which you can say, to me, that's half full. I may not pass math, but 20% counts to me as half full. And there can and should be prosecution. There has been one prosecution that I'm aware of in the history of attacks on healthcare, and that grew out of the war in former Yugoslavia, but that's really unacceptable. Finally, the responsibility to protect is a doctrine that says the world has a responsibility to protect people from major human rights violations and crimes against humanity. There could be, and that involves early warning systems, diplomatic action and pressure, and in the last scheme of things, direct intervention. So those are all possible, and they're only possible really because of pioneering work that Bob Lawrence and his colleagues back in the 80s and throughout the 90s and beyond did. And now we kind of complete this by having the other element of human rights, which is mobilization. And there is now a global coalition on this issue, which we hope will make all the things I talked about, the four elements of human rights protection for health and conflict, possible. So we are hopefully on the cusp, and we've come a long way from what Bob and his colleagues had started, and seen how the world of public health and the human rights are inextricably connected, and that protection can perhaps help us enable people to preserve their health and their lives. So that's it for me. Do we have time for questions? You want to come up, Jennifer? And we'll see if Jack is... You want to bring the phone? Jack, are you still with us? Why don't you take a question? I'm going to...
Okay. He's trying to get Jack. Is there a question? Yes, please.
Thank you very much for all this inspiring examples and history. But this is a very discouraging time to consider these events.
Ellen? Yeah? Can you wait for the question? We have a microphone being broadcast and recorded.
I wanted to first thank all the speakers and, of course, Bob for inspiring this, that we could consider these issues. But this is really a very discouraging day to think about these issues. And I take your point, Dr. Leaning, and thinking about it seriously, that perhaps the separation of all of this from politics and economics has been a little dangerous. Because I read in the New York Times this morning that there was all this material delivered to Sierra Leone and it can't be unloaded because there's a political squabble with the importing agency as to who pays the lading fees. So I'm wondering whether we should make so much of the separation of these issues, which you did so eloquently, and whether that perhaps has a downside.
It's a very good question, and others on this panel may want to answer it. Jack, the question is whether there's a downside to distinguishing between human rights and anti-war activism and social justice, since everything is everything. Yeah, wait. Well, actually, Jack has a response. So since we've got him here, Jack, do you want to respond to this question? I think I summarized it okay. Is that right? Yes, okay.
Okay. I'm not sure the right word is downside, but there is a predictable response. If one talks about social justice together with talking about human rights, which is that there are people with conservative views that will almost immediately attack the latter. And indeed, if one goes up and down the radio dial and listens to any of the flood of conservative pundits, you will hear them attacking and sneering at any mention of social justice as something close to subversion. But they are, in my own mind, number one, indistinguishable, in the sense that if one is talking about social determinants of health or human rights in that context as the area of violation, and not mentioning the larger context of social justice, you are being incomplete. So you need to be prepared for the attack. And part of the response, I'll here draw on my experience in Mississippi with a hostile state and a hostile majority white population. If you talked about social justice, you could, in the framework of human rights and the human rights work that you were doing and that you were quoting and asserting, the first response was to quote the data, because the data was unanswerable in connoting both injustice and human rights violation. Very often it was the state's own data on health, on inequality, and on its consequences for health. And one could turn back, indeed, as Jennifer did, to our founding documents and the Constitution and the framework in which the political manifestations of the Enlightenment had occurred. And one further part of this is useful in that context because I always try to, if you do social justice, you are going to hear about agitators and subversion in whatever disguised criticism. And it's useful to make clear, in the American context at least, how long a part of our own history this controversy has been.
Jack, could I just pick up on that for a moment? Thank you, because I think human rights allows for an international discussion without rehashing one's own history. There is a purity of documentation about it, even though, as Len says, much of it still is in process and has to be argued for. The United States has signed up to a wide range of these documents, and although it's not signed the International Covenant on Economic, Social, and Cultural Rights, has not ratified it. It has signed it, which means that from a constitutional point, it pledges not to enact law that is in contradiction to that covenant. We can argue whether it has or not. But there are ways in which one can advance an argument in this contested time now, using human rights language that is going to find it hard to advance if you're using social justice language. And but I'm not just using it as making that distinction from a standpoint of practicality. I am saying that there is an international consensus that has been built, very hard won, on this form of legal stance towards people who suffer, that provides an extremely important international and common platform for furthering the causes that we all care about.
One more question.
I don't know if this fits
I
into.
need a microphone.
I'm sorry.
I don't know whether this fits into your discussion right now, but it is a very minor social justice problem that I just heard about yesterday in regards to the Ebola in Texas. And it was because a black man is the one who brought it back, et cetera, that children are calling black children in schools Ebolas. That disturbs me because that's a young generation that's coming up with discrimination in a big way. Can you address it? I don't know. It may be irrelevant.
Right.
Yeah, I mean, I think this is the point that social justice and human rights law has a lot to say about that. Discrimination is one of the main violations. Jack, do you want to respond to that? Did you hear the question?
Here's the question. If you could summarize quickly, Jennifer.
That just last day or so, the person who raised the question noted that kids in Dallas are calling black kids Ebola kids.
Mm-hmm.
Or
Go
calling
ahead,
them,
Jennifer.
calling them Ebola, just like that.
Yeah. And
Well, I guess the question is, I don't think there's a distinction there in terms of, there are different arguments there, whether it's social justice or human rights. But I guess the question was, how would we respond to that? How would we analyze that problem?
I think again, my first instinct is to respond with data, and there is simply no basis in the United States for conflating race and Ebola. But beyond that, that's an attempt to enlarge an existing set of stereotypes that have discriminatory impact as well as personal impact. And the answer is to speak out on both arms of that equation. That is, that activity is both a human rights activity and a social justice attack.
And it's based on profound ignorance, which one isn't going to lead with in terms of talking to an individual, but part of it is to show, as Jack was saying, the data, that is sort of a preposterous stance to make. At least that would be a case you'd make to the parents.
So, well, thank you, Jack and Jennifer, and
you.
now, so Jack, I think I'm going to turn off the phone now. So thank you again, Jack.
My pleasure, and my pleasure to talk to this audience, and my pleasure to listen to Jennifer, and my pleasure to tell a story on Bob Lawrence.
Okay. Bye-bye. Bye. You know, those of you who have ever been to a Passover Seder have heard the phrase Dayenu. We sing a song called Dayenu, and it means it would have been enough. Well, you know, if Bob Lawrence had done nothing more than make a huge impact on health and human rights, it would have been enough. But he did a lot more. And through the Center for Livable Future and his work on food and environment, he's made a huge impact. So we're going now to the next part of the program, and it's my pleasure now to introduce Dr. Kellogg Schwab, who's in the professor in the Department of Environmental Health Sciences here, and he's director of the Water Institute at Johns Hopkins, which is an amazing institution in its own right. Its researchers across the university, from public health, engineering, business, behavior, policy, and economic disciplines, address the critical triangle of water, food, and energy. And the goal of the Water Institute is to achieve sustainable, scalable solutions for disparate water and sanitation needs, both internationally and domestically. The group has done amazing work in evaluating public health impacts of improving water access and potable water quality and the effectiveness of point-of-use water treatments. So it's my great pleasure to introduce Dr. Kellogg Schwab for the next part of the program.
Thank you very much. It really is an honor and a privilege to be here, and I'm really excited about this opportunity. We're shifting gears a little bit, and it shows you some of the diversity that Bob has brought to the School of Public Health. And what we're going to shift our gears into is why would a School of Public Health be involved in food production and the issues around that. And I'm also really excited to be here because I was that little tater tot about 4 decades ago running around the neighborhood that Bob Lawrence lived in Chapel Hill. So I've known him for many decades in there, and I'll tell a little story at the end as well in there. But what we're going to do for the next 6.5 hours is talk about my most favorite topic. We will keep these succinct. There's going to be 3 presentations. I'm going to talk a little bit about some of the issues facing the environmental aspects of these concentrated animal feeding operations. We're going to shift gears then, and Dr. Price is going to talk about the molecular characterization of some of the microorganisms that I'm going to set the stage for. And finally, we're going to have a wrap-up of how public health can be brought together on this issue of food and production. So what I'm going to do is really set the stage about the impacts of environmental exposure. And to do that, I'm going to tell you with a little bit of a story to really work on it, about environmental pollution and the challenges of sanitation and pollution and the struggles that have been throughout the world. And what I'm going to start with is actually this. Many of you in the audience may remember the Cuyahoga River fire, June 22nd, 1969. When you have a flammable sign on a river, that is not a good thing. When you have a river fireboat that is on fire, that is not a good thing. What was happening in our riverways at that time was they were so polluted from industrial waste that there was finally enough public outrage. Time magazine put this on the cover that the people said, Congress, you must do something. And a few years later, they passed the Clean Water Act to make all our waters that are navigable be fishable and swimmable. We haven't achieved that, but we have the act there. I draw your attention to this particular date. This riverboat fire, where it's being put out, is 1952. That river was on fire about a dozen times for decades before there was enough outrage and evidence to drive change. We have the same challenge now with agricultural aspects in the United States from both point and non-point pollution. We have eroded sediment that's impacting our bays and our estuaries. We have fertilizers, where inappropriate use of fertilizers, not only from agriculture, but from also individuals within their own homesteads, are washing off into our rivers and causing eutrophication. That's where too many nutrients get in your water, cause the algae to bloom, the algae die, the bacteria consume the algae, and you get dead zones, lack of oxygen, complete death in the water. The Chesapeake Bay has a dead zone that is getting larger each year. The Gulf of Mexico and the Mississippi has a dead zone. You also have the use of pesticides that might not be as appropriate or structured in there. But more insidious, and what we're going to talk about today, is animal waste, especially from industrialized animal feeding operations. Concentrated amount of animals, increased amount of nutrients that you have to deal with. And for today's focus, antibiotic-resistant bacteria and the challenges that are facing us in our food supplies with this. Now, I attest to you that this isn't something new as well. And actually, from the medical profession, there has been a concern of environmental exposures to animal. therapeutic, subtherapeutic use. And there was some seminal papers that were put out in the New England Journal of Medicine in 2001. And there was an editorial that was put out then too by Gorbach that says the subtherapeutic use of these antibiotic agents to promote growth and feeding efficiency should be banned. A move that would decrease the burden of antimicrobial resistance in the environment, provide health-related benefits to both humans and animals. Coming from the medical profession, now decades ago, realizing that there is a problem. Well, what we've done here at the School of Public Health is explore this. And my own research, as I started here in 1999 as a young assistant professor, looking for ideas and talking to Center for Livable Futures, was let's see what's going on in swine production facilities. And it was the students that were the glue that allowed us to explore this. And we explored the opportunity to look at what was going on here in these concentrated animal feeding operations. This is a building that contains swine. If we zoom into one of these buildings, you can see 5,000 swine are in each one of those buildings. So in the foreground, we have 5 buildings, 25,000 swine. Less than a quarter of a mile away, another 5 buildings with another 25,000 swine. 50,000 swine within a quarter of a mile. Now each swine excretes the amount of urine and feces as 3 individuals. This is equivalent of a population of 150,000 people. All the waste from these animals are stored in cesspits outside of these swine buildings and then applied directly in the local land, year-round. What we were able to do with investigations through the Center for Livable Future and our students is explore this challenge about the microbial side of what's going on within these animal husbandries. A bucolic setting, a covered bridge, young tater tots swimming in the water right here. These kids are playing. If you pan to the right, 250 yards, there's a fully industrialized animal production facility that is going on just upstream. These are the air vents, and there's about 9 or 10 of these air vents from the building. Swine metabolize, they generate heat. You need massive amounts of air to flow through those buildings to keep the swine cool enough for them to be able to survive. All the waste that's stored from this particular swine facility is stored in a cesspit below and around these buildings. And we were able to go in and have access and investigate this particular animal production facility. And when we did, we looked at the bacteria that were present there. And what we found is that there were about 10 million E. coli and 5 million enterococci per liter of this effluent. Now, many of these cesspits can contain 100 million liters of effluent in there. This is equivalent of 250 trillion E. coli and 130 trillion enterococci present in this facility's holding pan. We didn't stop there. Now, E. coli is zoonotic, animal to human. One of the more insidious things is my graduate students and postdocs and others looked at what was the antibiotic resistance level of these microorganisms present in that animal waste. Because many of these animals are fed subtherapeutic doses of antibiotics to promote growth. And what we found, 69% were resistant to erythromycin, 85% were resistant to tetracycline, but none were resistant to vancomycin. Why? At that time, these 2 drugs were approved for the non-therapeutic use in swine, but vancomycin that had never been approved for the non-therapeutic swine, none of the microorganisms were resistant to that particular drug. And we were able to publish this in Environmental Health Perspectives. It did take us several years to get that information out, because this is the challenge when you try to break into these different environments and communicate this information. You have to go through a rigorous, evidence-based, peer-reviewed process. But we didn't stop there. At that facility, my colleagues were also interested in airborne transmission. And so Anna Rule and Tim Buckley and others that were at Johns Hopkins at the time investigated what's going on in the air within that building. And they isolated over 1,700 enterococci per cubic meter of air. Now, a worker breathes about 1.5 cubic meters per hour, so the workers are exposed to 2,500 of these enterococci per hour. Remember those massive vents? They're blowing that air out, and it can travel for kilometers down gradient, downwind, with these enterococci and these other microorganisms present in that air. When we looked at the antibiotic resistant the microorganisms in that air, 95% of the airborne bacterial isolates were multi-drug resistant. When we investigated enterococci, streptococci, and staphylococci to erythromycin, clindamycin, virginomycin, tetracycline, and vancomycin, most of the microorganisms, the bacteria, were multi-drug resistant. These have been approved for non-therapeutic use. This was never approved. We published these information in journal to develop that evidence base. We went further and looked at the molecular characteristics of these microorganisms present there. And what we found is that highly prevalent multi-resistant genes reported here suggest that airborne gram-negative, gram-positive bacteria from swine operations may be important contributors to environmental reservoirs of resistant genes, swapping genetic information between bacteria that could then potentially relate to public health. And you'll hear in a few minutes about some of the challenges that we molecular characterize that. So we're setting an evidence base through projects that were generated from funding and support through the Center Livable Future and ideas that we bounced around through discussions with Bob and others. So what can we do? This is part of the challenge is coming up with a solution. Now, the single most important thing we can do is what every one of our mothers told us. In particular, my mother was a family nurse practitioner. She actually worked in a rural health clinic that Bob Lawrence helped develop in rural North Carolina in the 70s as a nurse. And you know what every mother tells their children: wash your hands. So that's my message first. I have to say that out there. We must wash our hands. It promotes public health and is universal. But related to this particular aspect as well, what about we need to consider purchasing antibiotic-free foodstuff and exploring alternative diets? Today is Monday. There's promotion going on with respect to diets during Monday, with Meatless Monday, and other things that we can do as individuals. And importantly, we must communicate. We must be able to articulate beyond just the peer-reviewed publications and let legislators know that antibiotic-resistant bacteria in our food supply must be eliminated for the health of your family and our environment. These are things that we can all choose to do now with the evidence that's supported by peer-reviewed publications and other research that's going on. What about the future? What we've been able to do is take these data and explore what happens if you do decide to change things. And recently, through Amy Sipkota, who was Amy Chapin at the time, she was a doctoral student then. She's now a tenured professor at the University of Maryland working on these things, so we've continued on. We investigated that when there was voluntary removal of antibiotics from large-scale U.S. poultry farms that transitioned to organic practices, there's a lower prevalence of antibiotic-resistant and multi-drug-resistant enterococci. And we also explored it. The same thing we found, that this year in 2014, these were some of the first U.S. data show that immediate on-farm changes in the prevalence of antibiotic-resistant salmonella when antibiotics are voluntarily withdrawn from large-scale poultry facilities. Does that mean it's a perfect solution? Absolutely not. It's still a production facility that might not be sustainable, but small steps. You change the way those animals are fed by removing the antibiotics, you get less antibiotic-resistant bacteria that are present there. This is what you need to prevent these infections from occurring that we can't stop once they get into the communities and into the individuals. Well, how did this come about? Clearly, when I started this now, well over a decade ago, it was through discussions of Bob Lawrence and Polly Walker and Sean McKenzie and all the entire Center for Livable Future, Sid and Helene Lerner. There was no way I was being able to successfully get funded for these alternative ways to explore how we can tie public health and agriculture together. Back then, there was not an understanding of why a public health school would be involved in it. We started to make the connections into that. So it was clearly that the CLF was able to support that. And the students and technicians and postdocs who work countless hours under challenging environments. This is not enjoyable research. Really hard. Many of my students who weren't vegetarian became vegetarian. And we started finding data that were very disturbing for our own health. When you look in the exposure levels after you get back to the lab, 3 days later, you realize that 95% of the bacteria you're working with are multi-drug resistant to bacteria that could cause an illness in our own families. That is something of concern. No one gave up. No one stopped doing the research that was important to that. They're the unsung heroes why I'm able to be up here talking. And my faculty collaborators inside and outside of Hopkins, the teamwork, that transdisciplinary nature of it. And importantly, it's the farmers and the communities and those environmentalists struggling to make a difference in our world. I am pro-farmer. I am for those individuals. She and he need to be able to be stewards of the land. We need to provide them the evidence base to show that there are opportunities to change. There are ways that we can take this integrated practice and shift it. Through the Center for Livable Future and through what Bob has pushed, forward. We're exciting as we move forward with this as well. With that, I thank you for your attention, and I will conclude it here. I have the opportunity now to be the host for the rest of this and provide some introductions for our next two speakers. If there's time at the end, we're going to have some time for questions as well. So I'd like to introduce Dr. Lance Price. And Lance Price is a past Johns Hopkins Center for Livable Future Learner Fellow. He received his PhD in environmental health sciences at the Bloomberg School of Public Health, and he's currently a professor in the Department of Environmental and Occupational Health at the George Washington School of Public Health just down the road. Prior to joining George Washington faculty, Dr. Price served in the faculty of the Arizona-based non-for-profit Translational Genomics Research Institute, and he maintains an appointment there in TGen, and continues to direct their Center for Food Microbiology and Environmental Health and Center for Microbiomics and Human Health. Dr. Price is pioneering the use of genomic epidemiology to understand how the misuse of antibiotics in food animals affects public health. By analyzing the genomes of the bacteria found in humans, food, livestock, and the environments near these food animal production sites, he and his colleagues have traced new strains of antibiotic-resistant pathogens to industrial livestock operations. Dr. Price communicates with policymakers, journalists, and the public about the public health issues, including how routine use of antibiotics for food animal production contributes to the spread of antibiotic-resistant infections. He's also an entertaining individual that we're able to work with there that keeps us all on our toes. With that, I'd like to introduce Lance Price.
Thank you very much. So my assignment is to talk about how we're using molecular biology to study this problem of antibiotic resistance from food animal production to human health. But what I'd really love to do is just stand up here and talk about what an inspiration Bob Lawrence has been in my life and to so many other people. But that's not my assignment. So I'm going to stick to my assignment. And Bob, I wore a tie. Bob invited me to give a talk once, and I forgot to wear a tie. And he wagged his finger at me. So today I'm wearing it. So it was really through I'm trained as a molecular microbiology, but it was my training here, working with Ellen and working with Bob and working with the wonderful faculty here in the School of Public Health and the Department of Environmental Health Sciences, that I learned that while doing really good solid science is important, for it to be translated, to be translated into better public health, sometimes we need to talk to these people. Sometimes we need these to be translated into health science-based policy. And those of you who have worked in policy will realize that sometimes when you talk to these kinds of people, you get difficult questions. And so one of the things that I constantly hear now is, what's the proof? What's the proof connecting antibiotic use in food animal production with antibiotic-resistant infections in people? And it's hard to have a nuanced discussion about, proof versus evidence with a policymaker. So I just quickly pivot and just start talking about the evidence. So what is the evidence? I think there are a couple of really important lines of evidence that show a clear link between antibiotic use in food animal production and antibiotic resistance in people. So let's review that before we get into the molecular biology. So using antibiotics in food animals selects for drug-resistant bacteria. Alexander Fleming told us about this in the 1930s and the 1940s, and we have seen it in petri dishes and test tubes in people, hospitals, and also on farms. There have been multiple studies showing that when you use antibiotics, you select for drug-resistant bacteria. And much of the great research coming out of our own School of Public Health here and funded by the Center for Livable Future has only solidified those studies and has shown that the environments within and around these facilities are full of drug-resistant bacteria, as Kellogg described, as Amy Sakota, as Jay Graham, as Ellen Silbergeld have done these studies showing this. So check, we have that, right? We also know that antibiotic-resistant bacteria make their way from food animal production to humans, so they can move from there and colonize us. So we know that, again, from great research here, but also research from our colleagues around the world, showing that when we go and we study healthcare workers, food animal workers, we find that they have greatly increased risk for carrying drug-resistant bacteria. So one of the studies that Ellen and I did, we showed that poultry workers, the guys who catch chickens for a living, had 32 times the risk of carrying drug-resistant bacteria as their community peers. So these things make their way across. And then, of course, these bacteria also cause infections. So they don't just colonize us, but they cause infections. And you need to only look at the Salmonella and Campylobacter data and see all the hundreds of thousands of people getting infected with drug-resistant strains of these bacteria to know that these not only move across, spill over from animals to people, but they also cause infections. So when people tell you there's no evidence linking this, you can tell them they're wrong. Check. Okay, and so the other thing that I learned from Bob and my mentors here at the School of Public Health was to communicate to these policymakers simply and clearly. And so I learned how to draw Fisher-Price characters. And I explained to them, I went up to the Capitol Hill and I said, look, animals like people have a microbiome. When you feed these animals antibiotics, you select for drug-resistant bacteria. Those bacteria can make their way through the environment and through the food supply and then cause drug-resistant infections in people. And I thought this would be enough, right? Isn't this clear? And I sat back and I waited for action, as many people have done, as Stuart Levy's been doing for 40 years, waiting for action. And no action took place. And it turned out, I went back and I said, why aren't we acting? Why aren't we doing something here? And they said, yeah, we believe you, but what's the body count? How many people are dying? So, we go back to the easy stuff, right? We go back to the Salmonella and Campylobacter. And I say, well, the CDC says that 410,000 Americans get drug-resistant infections from Campylobacter and Salmonella, and that most of the resistance here can be traced to either contemporary or historic antibiotic use in food animal production. Isn't that enough? I mean, that's about the population of Miami getting drug-resistant infections each year. And I'm sorry, I don't want to be cynical. I think that we all hope for the best. There's not enough dead people from these two bacteria for them to care. The body count is not high enough. And so they've been pushing us towards, studying the harder bugs. So what are the big killers? The big killers are E. coli and staph. They don't look like big killers when they're stuffed animals, but and microbiologists are weird, I know. But these are the two biggest killers in the bacterial killers in the United States. These kill over 50,000 Americans each year, just E. coli and staph. And they're harder to study than the Campylobacters and the Salmonellas because they're what we call colonizing opportunistic pathogens, or COPs. And I mean bad cops, not like Andy Griffith here. I mean, we're talking bad characters. And it turns out that these things can colonize us, and it can take maybe decades before the time that we've been exposed till the time we have an infection. So that's why we call them colonizing opportunistic pathogens. They wait their turn. And so that's different than, say, the dramatic food-borne outbreaks that you see with Salmonella, where somebody gets exposed or a group of people get exposed from a contaminated product, and then everybody gets sick. So these things are easy to recognize, whereas this can be the slow bleed over, spillover from food-animal production. And the other thing about these colonizing opportunistic pathogens is that they can have diverse life histories. So some of the E. coli, some of the staph can be totally livestock independent, can be circulating among us independent, and we can have selection in hospitals that can lead to drug-resistant strains that spread. Some can spill over from food-animal production and cause infections in people. Others can spill over and then circulate among people independently of food-animal production. So that makes this challenge even harder. And that's why we've had to really adopt some of these molecular techniques to start to tease this apart, to understand what proportion's coming from food, what proportion's from hospitals, and what proportion is coming from food and then circulating independently. And maybe it's my time at Center for Livable Future, but I think trees are the answer, but not necessarily the green trees, but evolutionary trees. So it turns out that evolutionary trees can really help us to understand infectious diseases. And so we've been applying really high resolution evolutionary trees to understand how bacteria are related to one another. So in other words, we can in a phylogenetic or evolutionary tree, we can recognize that two bacteria are identical and that they are different from another bacterium. And so maybe we can link a bacteria, an infection, to a source, perhaps a farm or a piece of meat. And then by using some advanced techniques, you can also root these trees to understand the direction of evolutionary history. So you can understand the origins of drug-resistant bacteria. You can understand more ancestral bacteria to more derived. And this is a powerful part of this technique. so I'm going to tell you how we're using this then to study the COPs. So for a scientist, this is almost as good as a time machine, I'd say. So we're working on E. coli, Klebsiella, and Staph aureus, but I only have time to talk about staph, so let's do that. It turns out that staph colonizes about 30% of it, so of us. It lives in our nose or on our skin. It infects hundreds of thousands of people each year, and those who are colonized are at excess risk for these infections. And MRSA alone, that's methicillin-resistant Staphylococcus aureus, that kills about 11,000 Americans each year. So this is a bug worth studying. And if you want to learn more, you can read Maren McKenna's excellent book called Superbug. But you can save the money and just go to the CDC website too, if you'd like, and you learn about the 5 C's of MRSA transmission. That's crowding, frequent skin-to-skin contact, compromised skin, contaminated items and surfaces, and a lack of cleanliness. So these are the things that we know facilitate the transmission of MRSA. And if you go on and read more at the CDC website, they'll tell you where to avoid if you want to avoid these 5 C's. That's schools, dormitories, military barracks, households, correctional facilities, and daycare centers. So avoid those places. But when I see the 5 C's, that's not what I think of. I think of a concentrated animal feeding operation. And there's no place where the 5 C's are more evident than this environment. And then on top of this crowding and this frequent skin-to-skin contact, et cetera, you have rampant antibiotic use, selecting, driving for the emergence of drug-resistant strains like MRSA. And so it's no wonder that we've seen in recent years the emergence of livestock-associated MRSA. And this disproportionately affects farmers, livestock workers, and veterinarians that are involved in livestock production. And we're learning now that there are many different types of, or strains of livestock-associated staph and MRSA. The one that's become sort of the quintessential strain is something called sequence type 398. And that's, we designate that by sequencing 7 genes around the genome, and we assign this name. So we wanted to understand the origins of this new pig MRSA and figure out where it came from. So we applied these next generation DNA sequencing technologies to a whole collection of ST398 isolates that we collected from around the world with our Danish colleagues at the Danish CDC, the Statens Serum Institute. And we applied this next generation DNA sequencing technology to really look carefully at the DNA and develop some high resolution trees, phylogenetic trees. Now initially, using the gold standard typing method, this is what the tree looks like, right? So if you took a bunch of these isolates, these Staph aureus, they're just flat, right? It's a pretty boring tree, or in phylogenetic talk, uninformative. But once we looked at the DNA, sequenced the DNA, we could see these little mutations that allowed us to form a very high resolution tree. And in fact, we found over 4,000 informative mutations, and we formed this very detailed tree. Now, this is neat to a phylogeneticist, but to a general audience, I think you want some metadata to interpret what this means. So let me layer on some metadata and just tell you that we've rooted this tree, so we know that these are the more derived and these are the more ancestral lineages. So let's layer on. Pink means it came from livestock. Gray means it came from humans. And I think you can see very clearly that there's a cluster of pink up here with some gray. These are all people employed in food animal production. And then these people down here are not employed in food animal production. And so you have, what we see is this big emergence of this livestock-associated MRSA, or livestock-associated staph here, that came out of the human clade. Now, when we layer on antibiotic resistance, what we see is a very stark difference here. We see tetracycline resistance is almost exclusively in that livestock-associated lineage. And when we apply methicillin resistance determinants, we see that methicillin resistance is also disproportionately reflected in that livestock-associated lineage. And when we look at the genes that code for livestock or methicillin resistance, we see that this is a very diverse collection of genes up here and different from the one that those couple that we saw down in the humans, suggesting that there's a strong pressure for resistance up here, and that these resistant strains have emerged multiple times. So this supports a very simplified model here that ST398 started off in people, spread to livestock where we use lots of antibiotics, and made that transition from methicillin susceptible to methicillin resistant, and now has started spreading back to people, particularly people exposed to livestock. Now, we published a paper in 2012, and we were we've been very glad to see all of the response to this. This has had over 150 citations since then, according to Google Scholar. And it was also named one of the top stories of the year of 2012 by Discover Magazine. And I even got to hear Al Gore describe it. He did a pretty good job. He wasn't boring. But the story continues to evolve, as does Staph aureus, this ST398. And what we're learning now is that, yes, well, we think that the history is that it was circulating in people, spread to livestock. We then select for drug-resistant strains that then spread to people, particularly those people employed. We now learn that they can also spread to the people that live with livestock workers. And that's what we call livestock-associated MRSA. Now we're also seeing people who don't have either primary or secondary exposure to livestock picking this strain up. And so it's now circulating in the general community, so it's spilling over and now circulating. We see very clear examples of it being introduced into hospitals and setting off hospital outbreaks. And now we see pretty good evidence of ground turkey serving as a source of this ST398 in the community as well. So this thing is evolving, and when we look at the DNA, we can see the signals of it changing, readapting to the human host. And so, you can't just look at these things cross-sectionally and think that you know the picture. But I think altogether, this really brings home this idea of One Health that Bob Lawrence, I think, has been really an inspiration to the world on, which is to recognize the connectedness, the interconnectedness between us and the animals that we raise for food. How we raise these animals, the way we treat them, has an effect on the environment that has an effect on us. How much we consume has an effect on us. And then now we're also seeing that the way we use antibiotics in these animals can have an effect on us. And this is a bidirectional thing too. I mean, we are now learning that these E. coli, these staph, can transmit back and forth between humans and animals. And so the drug-resistant strains that we select for in ourselves can spread to animals, be amplified in these massive populations. We have 9 billion food animals in the United States, can be amplified and then distributed in our communities through our meat supply. And so it's really important to understand this interconnectedness. And so in closing, I just want to tip my hat again. I'm not wearing a hat, but I want to tip my hair to Bob Lawrence for all of his inspiration and communicating this interconnectedness to all of us. Thank you.
So now it's my privilege to introduce our final speaker in this section of it, and it's Fred Kirschenman, who's really going to kind of bring it together and talk about the growing recognition of the public health role in improving our food system. So Fred's been a longtime national and international leader in sustainable agriculture, and he shares an appointment as a distinguished fellow in the Leopold Center for Sustainable Agriculture at Iowa State University, and is president of the Stone Barn Center for Food and Agriculture in New York. He also continues to manage his 1,800-acre certified organic farm in south central North Dakota. Dr. Kirschenman is a professor at the Iowa State University Department of Religion and Philosophy and holds a doctorate in philosophy from the University of Chicago. He's held numerous appointments, including the USDA's National Organic Standards Board, and is on the Pew Commission for Industrial Farm Animal Production, a project that was part of the Johns Hopkins Bloomberg School of Public Health and funded by the Pew Charitable Trust. Fred's been widely recognized for his work. Farmers of Iowa. Other awards include Leader of the Year in Agriculture by Progressive Farmer, the 7th Generation Research Award from the Center of Rural Affairs, and the first medal for Distinguished Leadership in Sustainable Agriculture from the Glenwood Center in New York, and the National Resources Defense Council Thought Leader Award. Just last month, he was awarded the One World Award of Lifetime Achievement by the International Federation of Organic Agricultural Movement. With that, I'd like to introduce Fred. Thank you.
Well, thank you all, and let me also add my accolades to Bob, who has been a big influence on my life for a long time. In fact, somebody asked me today, Bob, when we first met, and I couldn't remember. It's a long time ago. But I want to take the conversation in a little bit of a different direction because what lies behind all of the things that we've heard and that I want to share with you is a deeply cultural problem. And it's a cultural problem that goes back far into our history, probably at least back to the Enlightenment. And I don't mean to say the Enlightenment was a bad thing, because obviously it helped us to free ourselves from some of the ideologies of the Middle Ages. But nevertheless, what it did was embedded in us this notion that somehow we as humans were somehow separate from nature, that now that we were freed from these ideologies that were confining us, we were now free to do what we wanted to do. And of course, what we wanted to do then was to dominate nature, and we tended to think of nature as a collection of objects that we could manipulate and change into what we wanted nature to provide for us. And so René Descartes, for example, said we had to become the possessors and masters of nature. We had to manipulate it. And then, of course, along came the Industrial Revolution, which gave us all of the tools and technology to do this that we wanted to do, to manipulate nature in ways that would provide us with the things that we wanted. And, of course, that included our food system. And we began to think of our food system as something that we had to do on the basis of maximum efficient production for short-term economic return, which is what we expected from all of our industrial economies. Henry Ford, who applied those principles first in the automobile assembly line, and of course, the way you do that maximum efficient production for short-term economic return is you specialize. Henry Ford once said people could buy any automobile they wanted as long as it was a black Ford Model T, because that was the only one he was going to manufacture. And you simplify your management. You know, he didn't teach every person in that assembly line to put a whole automobile together. Each individual simply did a small part of it. And then you do economies of scale. And he wanted to produce enough automobiles so that even all of his employees could afford to buy one. And that became the basis for everything that we did, and it also became the basis ultimately for our food system, particularly after the Second World War. And so what we wanted to do then, consequently, is we wanted our food fast, convenient, and cheap, right? Because we had convinced ourselves that if we get our food as cheaply as possible, spend as little of our disposable income as possible on food, then we'll have income to buy all kinds of other things. And it developed this culture of consumption. In fact, some of companies back in the early 1930s coined the phrase the gospel of consumption. The more we consume, the happier life we'll have. And this, of course, then affected totally the way in which we do our food. So we wanted our food fast, convenient, and cheap. And the way you do that is you specialize, you simplify your management, you go for economies of scale. And so any of you who drive across our countryside now in any industrial country, whether that's in Iowa or California or Florida, you don't see a lot of diversity out there. What you'll see is you'll see one or two crops, and you'll see animals as we saw them in confinement, because that's the way you achieve that maximum efficient production for short-term economic return. And we did not pay any attention to what that would ultimately do to our food and ultimately to our health. And we also ignored all of the ecological resources, the natural resources, which ultimately are the basis of any food system. And so we didn't pay any attention to the biological health of our soil. We didn't pay any attention to the contributions of biodiversity or genetic diversity, because it was all about specialization, simplification, and economies of scale. And so we ended up with a food system that essentially did just a couple of things, and that is to make as much food available as cheaply as possible, without any consideration for what effect this would have on our own health. And today, I don't think there is anyone who pays any attention to this that is still able to say that the way we produce our food and what we eat doesn't have any effect on our health. And Bob, of course, has been one of the people in our culture who has been a leader and a visionary in helping us to understand what the implications are. And so we now have, because of this way in which we've been approaching things, we have also developed a very interesting way in which we do not only our healthcare, but also our agriculture. And I'm going to read to you a short paragraph from the introduction to a chapter in a book that actually Bob called to my attention some time ago, called Creating Wealth by Holdsmith and Laetier. And when he first recommended, he said, this is a book that you might be interested in. I thought, why a book about creating health from a healthcare professional, creating wealth from a healthcare professional? And then I got to chapter 9. I got to chapter 10, which was entitled Putting the Care Back into Healthcare. And here's the part of the second paragraph in that chapter that really caught my attention. It says, the starting point should be to recognize that we don't have a healthcare system. Instead, we have a medical care system. And later on, they in fact talk about it as a sickness care system. Furthermore, income for that medical care system is produced essentially by people who are alive and sick. Therefore, only more sick people, not healthy people, lead to more growth and income in our in our sector. With such an incentive scheme, the system has become remarkably adept at keeping sick people alive. And when I read that, I thought, this is exactly the way we do agriculture. We do agriculture based on how much we can produce and how much we can do that on the basis of trying to suppress the things that we don't want. And Joe Lewis, who was a pest management specialist with the Agricultural Research Service, he's retired now, but he was the pest management specialist for about 50 years. And he published an article in the National Academy of Sciences proceedings back in 1997, he and his colleagues. And they made a very interesting observation about our agriculture system. And again, from the point of view of pest management. And what the point in their article was that we now try to manage pests in agriculture with what they called single tactic therapeutic intervention. So you have a pest problem, you come in with a pesticide from outside the system, that's that single tactic approach with therapeutic intervention and a way to try to solve that pest problem. And when I read that, I thought this is exactly also, which I had learned especially from Bob, the way we do our healthcare system. Single tactic intervention with a single tactic therapeutic intervention to solve the problem. We wait until people get sick, and then we come in with a technology or a range of technologies to try to get them well again, right? We don't really invest anything in what we need to do to keep people healthy. And we're doing the same thing in agriculture. We wait until we have a problem, either a pest problem or a nutrient deficiency problem, and then we come in with a single tactic therapeutic intervention to correct the problem. And we don't do anything about what we need to do to prevent the problem from the first place. And so the more I thought about this, this is really where, and I think this is one of the things that I learned from Bob, that Bob has been trying to work with us on, that we've really got the same kind of problem here. We have a systemic problem that we have to change. And so a big question then comes, the same question that you were raising earlier about how we change the problem with, all of the problems that we have in terms of the contamination and all of those things that affect our health. We have the same problem in terms of producing our food and in terms of managing health. And that is, how do we actually get to a point where instead of single tactic therapeutic intervention, we look at natural systems management? How do we put systems together in a way that they actually increase productivity in a positive way without doing damage to the environment, and how do we do that in healthcare? And I'm not quite sure that we can simply convince people that this is something they ought to do. And when you think about this in terms of agriculture, for example, we have now invested huge farmers, input suppliers like seed suppliers, food industry people like Cargill, ConAgra, they have all invested billions of dollars in putting a system together that they understood we wanted our food fast, convenient, and cheap. And now we see some of these negative aspects, and that it's not really giving us what we want, and we want to go to them, and particularly to farmers. Over 30% of our farmers now are over age 65, and they have put their whole life into producing what we thought we wanted, and now we want to go to them and say, hey guys, and gals, we don't necessarily like what we've done here, and we want you to change. Well, put yourself in that position, and it's probably not going to happen. So how's change going to come? And this is, I think, what all of us are here about today. And I think it's going to come because the current system can't work much longer, because it is based on a concept that assumes that natural resources that are necessary to produce our food this way is always going to be there. And that the way in which we do our health care, putting all of our resources into trying to get sick people well again rather than enabling people to stay well, is also going to become unaffordable. We're now spending 18% of our GDP on health care. And healthcare professionals that I've talked to are saying as they look into the future, they expect it'll get to 25%, probably by the year 2040. And at that point, 25% of our disposable income is going to healthcare. I think everybody here in this room understands it's probably not going to work anymore. So it won't work in agriculture, and it won't work in healthcare. And especially when we think about it in terms of agriculture, because when you look at the resources that we have been used to for this whole industrial era of our agriculture, like cheap energy, because we had fossil fuels, cheap minerals, because we had cheap fertilizers, cheap water, because we've had fossil water as well in our fossil aquifers, and we think that water is free and unlimited, and so we can use as much as we want, however we want. 70% of our fresh water now on the planet is used just for agriculture irrigation. And I think, as everybody understands, we're drawing down our fresh water resources all across the planet now. And then you add to that the fact that over this last century, we've had relatively stable climates, which our climate scientists are telling us is not our future. We're going to have more floods, more droughts. So already we're beginning to see this play out in California, as we all know. And then you got the Ogallala Aquifer, which is a major source of water for irrigation for the whole heartland. And two studies which were done just recently now has pointed out that at the rate, we've drawn down the Ogallala Aquifer by half since 1960. And according to these two new studies that have just been done, at the rate that we're now withdrawing water from the Ogallala, part of it because we're using it for ethanol, et cetera, that we only have enough water in the Ogallala Aquifer now for about another 20 years. So think about that for a minute. California no longer has not only the rainfall, but the irrigation water which used to come from the snow melt, from the snowpack in the mountains, which is no longer now there. And then you don't have the irrigation out of the heartland. What's that going to do to our future food system? So these are all, so I think it's going to be these, I refer to them as crises that are going to be coming at us, that all of us are going to have to deal with, and that's what's going to drive the change. And so the really important thing we need to do now is to anticipate the changes coming at us and get a head start preparing for them. And that's what I think Bob has done so remarkably well. There are others who are in the healthcare professional now, Daphne Miller, who's written this incredible book called Pharmacology, spelled F-A-R, not P-H-A-R, as you might expect from a healthcare professional. And she's actually pointing out how she learned how to do healthcare in her own practice from farmers who are using integrated pest management. In other words, looking at how they redesign the natural system rather than what kinds of inputs they bring from outside. And so there are these kinds of conversations that are now underway that I think can provide us with some of the wisdom that we need as we think about the future directions and anticipating the changes coming at us and getting a head start preparing for them. And that's what I think all of us in this room, I would hope, are going to be interested in doing. So let me end there, and we'll go to questions.
we have time for just a few questions. If you could please wait for the microphone to ask any of the presenters questions you may have, and we'll try to be succinct in our answers. Huh? Pause, reflection. Any questions? No questions. It's just about your food. That's all.
Great presentations from all of you. Thank you. I have a question for the first two speakers, both of you. How did you gain access to these factory farms, and are you still going to be able to gain access for your research?
You hit it right on the nose. I'll start that answer. Gaining access is incredibly challenging. There are a few farmers that were willing to allow entry, especially Carol Morris and others from the poultry side of things. They paid a price for doing that in the integrated system, where the supplies that they were getting were less quality than the other ones because they were willing to try to make some difference and get an understanding. Other farmers, we've been working with them saying there are ideas out there for interventions for reducing dust and for other things that would maybe in their own minds think that would be improvement, and they've allowed us to explore other aspects of that farm during that same time. It wasn't covert, but they were just saying, hey, you go ahead and do it. It's very challenging, and I know, Lance, you could probably communicate.
I've had to do my research in Denmark and the Netherlands because access and public health and democracy have a little different interpretation there. Here, it's interesting because there's always this question of what's the proof, and then we're blocked access to the very thing that we need to really understand and quantify connections, which is the source samples. The inputs genomic testing can only be as good as the inputs that you're putting into this machine. And without those source samples, it's hard to know. This ST398 strain that I talked about, it's unique, and so it has a unique fingerprint. It's an easy one for us to pick out. But we know that there are other strains there that look very similar to the ones that we've seen in hospitals for years and communities for years. But until we can get access to the animals and sequence those and compare those and do the same sort of evolutionary history study of those, it's hard to really nail it down. And I think the industry likes that. And so we have to use food as a proxy too.
Hi, I've got a question actually for all three of you. Maybe quick answer. We've got 9 billion animals that are raised a year and slaughtered for food. Is there an answer to this problem? You mentioned, Lance, Denmark. Can CAFOs be fixed, or do we need an entirely different model, as Fred was suggesting? Is there a way to actually address this and still provide animal protein, or do we need to steer away from animal protein towards something else?
You want to start?
Well, I think, first of all, the question behind that question is how much meat should we be eating? And I think at least most healthcare professionals that I've talked to are in agreement that in the industrial world, we're currently eating too much meat. So if you start to think about this as a whole system, if we were to use more of our grasslands for our ruminant animals and raise them on grass, plus forages in times of when weather doesn't allow them to be on grass, the forages also would be important in terms of our crop production, because when you use forages like alfalfa, which put natural nitrogen into the soil and restore the biological health of soil, so you don't need as much fertilizer, et cetera. Or even when you use, one of the encouraging things right now is a lot of farmers, even conventional farmers, are now starting to plant cover crops, because they realize when they put a cover crop in, say in a typical corn-soybean rotation, then they can reduce, if they do that consistently over 7 to 10 years, they can reduce their fertilizer and pesticide input by 70%, still maintain their yields, and the quality of their soil improves to a point where the soil absorbs 8 inches of water an hour instead of a half inch of water an hour. And so they begin to see the immediate economic benefits from that, and so that becomes attractive. So I think that we have to start thinking about it as a system. And if we think about it as a system, then we'll raise less animals, but the animals will play a critical role because, like in cover crops, they can use the animals to mob graze the cover crop so that you can then no-till the next crop into the field. So all of those benefits from those integrated systems can be realized. But if we insist on eating as much meat as we're eating, then of course that's not going to supply the demand. And one of the books that I've read that really inspired me about all this is a book by Simone Fairley, who published a book called Meat, a Benign Extravagance. And what he does is in his book, he looks at different ways that we can eat. And then he asks the questions, if we all ate in a particular way, what impact would that have on the health of the landscape in which we live? And two of the examples which are sort of at opposite ends, one is if we all became vegans, what would that do to the health of the landscape? And he says, well, again, from a practical perspective, you would have to use more fertilizer because you wouldn't have the animal manure as part of the fertility for the soil. And then you'd have more nitrous oxide. Or he said you'd have to raise more alfalfa, but if you don't have animals, what are you going to do with the alfalfa? So it's those very practical kinds of approaches. And then he asked the questions, if we all ate as much or even more than we do in our industrial world, and then of course he goes through the impacts of that, which I'm sure everybody in this room understands, so I don't need to go into some of the negative impacts. And that's why he calls meat a benign extravagance. It's an important part of the system and animals in the system. But if you put the system together in a way that provides the kind of resource restoration in our whole system, then we'd actually come up with a pretty good food system.
And I'm going to answer shortly too, is that Bob, not only is he a researcher and gatherer of individuals, he's a teacher as well and communicates very effectively in many classes. And one of the examples he's used is the genie's out of the bottle when the Brazilian rainforest is cut down for soy, which is transported to China, and China is now adopting a meat diet that's similar to the United States. What are we going to do as a species? And so this is part of this challenge, not only in the United States with innovative ways that we now have a global economy of scale that is somewhat challenging, and future generations are going to have the work cut out for them. Unfortunately, we must stop here with this dialogue. I would like to thank the presenters here. Thanks for everything.
I know that the men's and ladies' rooms were stressed given the number of people there used to be behind this, when this was our main auditorium long ago, there was only one toilet for the entire auditorium, which then actually held twice as many people. So we've come a long way. So for those of you who don't know, I'm Al Somer. As Mike Clegg likes to say, he's number 10, I'm number 9, so I was his predecessor. This is the really fun part of the session where we get to roast Bob royally, as opposed to talking about nice things. But I haven't seen Grace. Where's Grace? You are here, Grace. Okay, come on up, Grace. So our first speaker, terrifically, is a young person, is Grace Chan. And Grace, like Bob, actually, is a graduate of both Harvard College and Harvard Medical School. And then she came here and joined the graduate training program in clinical investigation while she was NIH fellow. And she is now continuing to do her studies, primarily epidemiological, on childhood mortality around the world, which is a main theme of what many of us do here at the school. And so, Grace, I'm delighted you could join us.
Hi, and it's a pleasure to be back and an honor to speak here and to reflect on how Bob has influenced my career in public health. I didn't realize this was going to be a roast, otherwise my speech might be a little different. So it's all mostly really nice things. But like most students, I learned by modeling, and in my short career I've had really great role models and some not so great models. And from the not-so-great models, they've taught me what I never want to be like. And it's much easier to learn from really good models. And Bob was perhaps the best model in public health a young student could ever wish for. So perspective, integrity, and passion were the three qualities that I wanted to talk about today. So in the summer of 2005, I was a bright-eyed and bushy-tailed medical student who came here to do an MPH. And Bob was teaching the summer program problem solving, and he took the time to meet with us students and to listen to our idealistic, lofty goals, probably thinking that there was no way we could probably solve some of these problems that we were trying to solve. But we were all really touched by his humbleness and the way that he would share his perspective from over the 50 years of public health experience he's had. And I would see how Bob used his sense of responsibility and sought the wisdom of his brilliant partner and wife, Cynthia, to realize what the important things were. And his stories would illustrate his reactions to the good and the bad and to the endless opportunities and challenges. So medicine typically follows a very traditional path. You go to medical school, and then residency, and then fellowship, and then you go into a junior faculty position, and then you try to get promoted. And Bob really shifted my perspective, because here was somebody who, in the middle of residency, went to work for the CDC as an epidemic intelligence officer, and then went back to Boston. As he was finishing residency, he decided to leave and go to North Carolina to develop the public health care system. And I still remember he told me he had difficulty deciding what to do, and he talked to Cynthia about it. And then they together decided to leave their life in Boston and go to North Carolina, where he went on to desegregate the healthcare clinics in North Carolina. And that's when I really just started to learn that there's no one way or right way to do things. And while life can really only follow a single path of experiences, following your heart and being open to otherness and imagining the world through a different lens can add some color to life. And so Bob had offered a window to another perspective that has shifted my own. In terms of integrity, I think it's easy to remain insulated, at least for me, in my own comfort, and to fall into everyday routines to avoid contradictions that arise when we see injustices and inequalities that are present in the world. But the author of Pedagogy of the Oppressed, Paula Freire, wrote that awareness often increases the presence of contradictions, often increases in the presence of contradictions. And Bob, I feel like, embraced a lot of these contradictions, guided by his core beliefs. So as a young physician, he was writing letters to Congress protesting human rights violations. I think it was during the Cold War. I don't know, because that was kind of before my time. But he then got a phone call that asked him to come out and help investigate these human rights conditions. And I think it was a member of a very powerful group of people, and he was this young physician. And he asked them, how did they choose my name? And he said that the response was that he had written the most number of letters to Congress. And I think it was close to 1,000 or something, a lot of letters. I just feel like Bob demanded attention to and action against things that he really, to these severe human rights violations and things that he really believed in. And he also lived what he believed in too. So as many of you know, he commuted every day to Hopkins on his bicycle, rain or shine. And so in the summer of 2010, when I came back here to start my PhD, Cynthia and Bob very generously offered to have me house sit for them, although they were really just providing me with shelter until I could find a place to live when I moved here. And so I was inspired by Bob, who rode his bike every day, so I was like, I'm going to do this too. So it was summer in August, and it was probably over 110 degrees out. And I swear it was uphill both ways. So the whole time I'm riding, I was like, wow, Bob is a true environmentalist. Because I could barely breathe going up the hill on Charles Street. And then lastly, passion. So what is passion? It's a motivator, a drive, a fire to do what you believe in. And my passion in the past has been to know people around the world, to travel, and to serve populations that are outside of mainstream. And as physicians and public health professionals, it's been easy to serve because this is our profession and this is what we're paid to do. And in some ways, doctors like me have the bad habit to try to be the hero because, I don't know, in some ways it feels good to be able to contribute to something. And I think there's a piece of that in my motivation, even though I don't like to admit it. But what I saw and learned from Bob is that if something is truly our passion, it loses our ego, it loses the ego and motivates for its own sake. And so Bob has taught me, and I think all of his students, to identify what our true passions are and how to be of service through that passion and be of service in whatever role we're playing, wherever we are, whether as a parent, a colleague, a partner, or a community member. So I just wanted to thank Bob for teaching me to take my own path and to try to follow my passions, and for inspiring all of your students. Thank you.
The next speaker, like many, needs no introduction. Jim Yeager, professor in the Department of Environmental Health Sciences, and was the second Edith Schoenrich. And Edith Schoenrich is sitting right over there. That's the first Edith Schoenrich, actually, but not the first Edith Schoenrich professor. She was the first Edith Schoenrich who was a professor. The first Edith Schoenrich professor was Bob Lawrence. The second Edith Schoenrich professor was my good friend Jim Yeager. Jim and Bob started some of the most innovative initiatives here at the school, and Jim's going to reflect on them.
Thank you. I'm only going to reflect on one, but anyway, I am a laboratory scientist, and I came to the school in 1989. It's hard to believe it's 25 years ago, to direct a toxicology program in the Department of Environmental Health Sciences. And I was fortunate to be given the opportunity to have leadership roles in the school's strategic planning processes. And it was during this engagement with the strategic plan at the school level I began to interact some with Bob Lawrence in his role as the Associate Dean for Professional Education and Programs. But then in 2000, Al asked me to assume the position of the Senior Associate Dean for Academic Affairs, and it was then I began to have a close working relationship with Bob. We all need mentors at all stages of our lives, but this is especially true when we step into new positions, and it was especially true for me as a laboratory scientist, having to take on the role of the Senior Academic Dean of the school, where I had to absorb and come to understand and represent the social mission of our work. Bob played a central role in the evolution of my public health orientation. Bob is a visionary with his eye always on the target of improving the health of populations. What comes to my mind when I think of Bob is Robert F. Kennedy's adaptation of George Bernard Shaw's phrase, "Some people see things as they are and ask why. I see things as they can be and ask why not." Bob has been and continues to be an inspiration to me and so many others. So I want to reflect on one example of where Bob and I work together to affect change and ultimately have a real big impact. We were at a new student orientation in late August of 2001. A faculty member, Mark Farfel, was describing the work of a student group he coordinated called Interaction. Interaction had a small office staffed by part-time MPH students with limited capacity and few resources. It was one of the only places to go for students who wanted to become involved in the local community through volunteer activities. Mark described some of the exciting community projects that students were engaged in. Then during the break, following his talk, numerous excited new students literally ran up to Mark to get additional information and find out how they could become involved with community activities. Shortly thereafter, I got together with Bob to learn more about Interaction. To us, Interaction seemed to be a great platform on which to build a structure that would facilitate a significant expansion of the school's engagement with the community. But to do this, it needed a full-time staff member who could manage the activities of the students and expand the outreach. So we developed a short proposal and took it to Dean Sommer. Al's initial reaction was, no. Well, needless to say, Bob and I wanted to do this, and we didn't want to accept that decision. So we were able to identify some resources in our budgets and then convince Al so that in 2002 we could hire a full-time staff person. And that full-time staff person's name was Paula Williams. As is true for so many of the activities and initiatives in the school, their success is critically dependent on getting the right staff person, and we hit a home run with Paula. She immediately began to expand the outreach of interaction and to put more structure into coordinating the students' activities. However, as is also true, many times excellent people seek greater opportunity. So in 2003, Paula left to go to graduate school, and we were left having to recruit another director of interaction. Through a search process, we hit on a grand slam home run and hired Mindy Levin. Mindy is a person with enormous energy and creativity. So Mindy created and greatly expanded the activities Paula had begun and started new creative initiatives, one of which was to bring the students of our school together with those in the schools of medicine and nursing to form in 2005 the Student Outreach Resource Center, better known to all of us as SOURCE. SOURCE has been enormously successful and now has over 100 community partners that provide opportunities for students to do volunteer work in the community, as well as for completion of their practica and capstone projects. And SOURCE has also facilitated the ability of faculty to incorporate service-based learning into their courses through its Service Learning Faculty Fellows program. So this is something that, working with Bob, we were able to accomplish and really have an impact outside of the area of food systems and other humanitarian activities. Bob, it was wonderful working with you when we were in the dean's office. You continue to be an inspiration and a role model to me and so many others through your inspired leadership of the CLF and your humanitarianism.
The next speaker is Polly Walker. Polly, I should tell you, and I were classmates at medical school together. In 1996, she joined Bob in helping to initiate the Center for a Livable Future and has really devoted her life to both health and the environment and their interaction. I should tell you that spending time here at the school, she decided to get her MPH degree. And when she walked across the stage and I handed her a certificate, there was some titillation in the audience as Bob, who was reading the names of the people walking across the stage, had to explain that the reason this particular student was being hugged by the dean is because they had been classmates at medical school together. Polly.
I am delighted to be here today to celebrate with you, Bob, and your family, and with all the many colleagues here today. As Al said, since 1996, I've been here at the Center for a Livable Future, helping Bob launch it in the first place. And I wanted to talk about vision. The center began with Bob's vision, and it seems to be a common theme in some of the talks that we've already heard. In 1996, newly arrived at, maybe it was 95, but near about, Bob arrived at Hopkins and was given a challenge. The late Henry Spira asked this question. He said, for 15 years, the Center for Alternatives to Animal Testing had been trying to replace and reduce the use of animals in laboratory testing for human disease and also for testing of products for safety. So what he wanted to know was there a similar public health approach to address the dreadful factory farms conditions for the millions of animals, 9 million, that were destined for our dinner plates? According to Wendell Berry, the food system is run by people who know nothing about health, and the health system is run by people who know nothing about food. Well, Bob Lawrence was one person in the health system who did bridge that divide and saw the links between those two systems. And he accepted Henry's challenge and wrote a summary, a proposal for a new Center for a Livable Future. And he underscored the links among unhealthy diets, environmental degradation, human health, and the factory farm system for meat production, all in the context of working for a livable future in a world of finite resources. Water is not unlimited, neither is soil. And the fax copy of that letter went out to Henry Spira that night. And in the morning, when the hard copy was still sitting in his outbox, a call came from the center's first donor asking how to help begin the creation of this center. And this is going back in time. We've already heard from Kellogg and Lance and seen some of the results from Amy and some of the other researchers of the incredible results. But this is before all that, when the center was just a vision in Bob's mind. So in April 1996, the center was born, and I arrived on the scene in the fall, I think it was early October of that year, just about 18 years ago now. And I was first the coordinator and later the associate director of the center, and thus began an absolutely wonderful journey working with the center and with Bob. The poster of Don Quixote was one of the first things you saw in Bob's office. And his commitment to justice, which we've also heard about in the first part of the speaker, was inspirational. And it underscored everything he did, whether it was teaching the Health and Human Rights course, working in the problem-solving course, his work with PHR that we heard about, and CLF itself and the equity issues that we were dealing with. And it wasn't tilting at imaginary giants that were really windmills either. It was real enemies. So one of the other first things I learned from Bob was he had this amazing number of apt quotes that he could just pull out of his pocket at totally the right moment. And one time when things, well, maybe several times when things weren't going well in the early days, he would quote from Mahatma Gandhi: "First they ignore you, then they laugh at you, then they fight you, then you win." So what was the reaction to a center dedicated to issues of farming and food production at the School of Public Health? What? It was basically disbelief for the most part. And this was 1996. In 1996 was before the food movement had gained steam, and particularly not in medicine or in public health. The environmentalists were way ahead on this one. Before Hurricane Floyd had thrust factory farms into the news, and before there was really any notice of the massive use of antibiotics on factory farms. And there was indeed laughter and turf protection, and as I said, disbelief that this kind of a center even belonged at a school of public health. Not Al was on board, and a few others. So this didn't bother Bob at all. He continued by gathering together the most incredible group of professors from across the university in an attempt to get people from different disciplines in this interdisciplinary center, to get people out of their academic silos, talking together to catalyze new ideas. Some of those people are here today. Sid Mintz from anthropology, Grace Brush from geography and engineering, and there was the late Carl Taylor from international health, and the late Gordon Woolman from geography and engineering, and of course Alan Goldberg from toxicology and CAT. So we began having conferences and talks and a newsletter and faculty meetings and more talks, and we had a first conference in November that year that had all the topics on it: global warming, poverty, animal production. There's a lot of talk and no action. And Henry Spear was constantly reminding us that this was to be a do tank. So one of the things universities do is research. And Bob's strategic decision in 1999 was to seek and obtain funding for research by students and faculty. And that was crucial to the long-term success of the center. And we've heard from some of the researchers today. And that research there have been dozens and dozens of grants, and I counted up something like 200 different grants over the course of the center's 18 years of existence. And that provided new data for policy and advocacy, and some of those students and faculty were already faculty. Some of the students are now faculty here and elsewhere. They work in government agencies, and most important, they're working on CLF issues. And CLF staff are involved in research too, and just this past week on October 2nd, we had Keith Nachman again in the New York Times being quoted for some of his research. So a full history of the CLF would take way too long, and we've actually tried to do that several times. But under Bob's guidance from that vision in 1996,
The CLF now has, from a staff of 1, has a staff of 25 full-time and 5 part-time people, 15 fellows, and 25 to 30 research assistants. And the research is ongoing. Courses on CLF issues are offered to students in several different areas. CLF is a player now in public policy debates, which we only dreamed about back then. And CLF is involved in the community, and the accomplishments continue to amount. But I want to turn now a little bit to what it was like working with Bob. And as the first speaker said, it's hard not to just be complimentary, actually. Bob is committed to his students. People matter to Bob, but both students and employees. For instance, Bob encouraged me to earn my MPH degree while I was here. And when I wanted to move near my grandchildren in Rhode Island, he encouraged me to telecommute, which I did very successfully for 5 years, and then I did retire. And the waves of students who come back year after year to tell Bob about their lives and their families and their careers is his testimony to how much you mean to all of us. Bob's a very hands-off leader. So with a minimum of direction and consultation, he expects you to succeed, so you do. And he also has this very calm and positive outlook that's infectious, and that's also been alluded to before. Sometimes it could be annoying because you would come with a problem. I never saw Bob lose his cool, even to the extent that Jack Geiger talked about, clenching jaw and all. But somehow he made the supposed problem seem like a tempest in a teapot. And you went back and carried on. And Bob also encourages new ideas. And the one that comes to mind most to me is that in Earth Day 2000, he agreed that the Center for a Livable Future needed to do something about the university's commitment to climate change, which wasn't happening at the time. And because we were the Center for a Livable Future, everyone kept emailing us thinking that that's what we were going to do. They didn't quite get what we were about. So when we talked about it that Earth Day, he immediately took it to the top and gathered quite a large group of faculty and students who were interested, and we had meetings and talk, et cetera, and we were ahead of the curve. But I believe that we laid the groundwork for what's now a major university commitment to climate change that had President Daniels in a blue Snuggie celebrating Earth Day 2014. So our hard work, although we didn't see the results of it, actually did pay off. And CLF space itself is LEED certified. So it's been a wonderful 18 years, Bob, for me and for the center. And I'm so very grateful that I had the opportunity to work with you and with the center. And I know that from your original vision, there's going to continue to be a bountiful harvest of new research, new ideas that comes from your vision and from the guidance you've given to it for the last 18 years. So thanks.
So now we have a special treat. The 5 Lawrence children, as I call them, the Lawrence Grown Kid Quintet, are going to come up here. And I've been that's Matt, Job, Hannah, Sangbo, and Jinsuk. And I've been told that Matt will channel the thoughts of his siblings who will surround him in moral support. Do I have that right?
Actually, no, 3 of us will be speaking.
3 will be speaking. All right, so everybody, should we have a bio break first, or what do you think? No, okay.
It won't be that long, but we do need to switch to a presentation that we
So it should be up there.
Oh, it is? Great, wow.
Well, I don't know what you just did.
No, I'll
Bring us
get back.
to
Don't
where
worry,
we
I
were.
work at a small technology company in
That's right.
California. I should be able to
We're
figure this
hoping-
out.
There you go. You got it. Now just push.
Okay, that's it. Go ahead, Matt.
So yeah, we are with Bob, but also have the distinction of being of Bob, and equally important, Cynthia. And we thought we would talk less about his academic accomplishments and more about the spirit of inquiry and leadership that fostered everything that he's done here and all the wonderful collaborations he's had with all of you. And I, thinking about what to share, a moment came to mind. years ago with the five of us here and our parents when, we're kind of a daily paper and national public radio family, so we're always soaking up information, whether or not it's relevant or even retained. But we had been sitting at our dinner table shortly after a radio piece about celebrating a great scientific discovery and the associated accolades, and my father mused, to no one in particular, I wonder what it's like to grow up in the family of a Nobel laureate. And that wasn't I think an aspirational question. It was just one of, what would it be like to be in the household where great thoughts were thought that, may have wider impact on the world. And, of course, that was said to a circle of adolescents. So one of us, who will remain unnamed, said something to the effect of, they probably just like talk about cars and stuff like that. And, of course, the discussion quickly moved on, and that thought in the air, although not addressed as a family, certainly stuck with me, because all these years later, not only by his involvement as a founding member of the Physicians for Human Rights, is he, by important measures, a laureate, but he also, was instrumental in fostering the spirit of great thought and inquiry that we as a family have always enjoyed. And it's made him a very, very important figure in our lives. And I think, from what I've heard today, important in many of those same qualities to all of you. And it certainly made him a very, very influential grandfather as well. Some of his grandchildren are here in the audience, and I'm sure would have as much to say about him as the five of us do. But we also did talk about cars, and they were a part of our life. So we thought we'd use that vehicle to share a little bit more about some of the important aspects of parenthood and just leadership that he did impart to all of us.
Okay, thanks, Matthew, or should I say, Dr. Lawrence. I, as the eldest son, willingly and handily passed on the baton to Matthew to pursue a career in medicine and medical research. But as Matthew said, we're here to talk to you about cars, or the life story of our father and the lessons that we've learned from him and the values that he has lived by through the cars that he's owned. So the first car exemplified his industriousness that we have all come to emulate in various ways. And this was a Crosley that he bought for $100 when he was in high school. He carried the engine down into his basement and rebuilt it and used the car to deliver newspapers, and was rewarded with a newspaper boy scholarship to Harvard. Then, a while later, I got a VW microbus, and that kind of represented his kind of open-mindedness, his embracing of new things and new elements in the culture. And this was in the late '60s, and he started hanging out with these little hippies, and we had a great time. And then his conservation. Under that pile of snow is our father's French-made diesel car that he purchased well before any thoughts of global warming were obviously on the horizon. And if you have ever owned or known anybody with a diesel, you know that cold weather and snow make them nearly inoperable. So it did sit under the snow quite a bit. But it was a wonderful reminder of him, because diesel's also a very loud, noisy car, so we always knew when he was coming home, because we could hear it coming up the driveway. And that driveway was a very long, steep driveway. And fortunately, the most reliable vehicle that he ever owned was this snowblower. Thankful for us, because if it didn't work, we would be press-ganged into shoveling the snow. But this is an example of his self-reliance. He would do things on his own, many things from raising bees to, taking on these chores like shoveling the snow. This we're segueing into a period of frugality. He had, 5 mouths to feed and 5 people to put through college. One of the I think the most enduring legacies of him was his real focus on education and the importance and value of it, not for any particular application, but just to keep all the options open, and his support in all of us pursuing very wide and eclectic range of options. Between the 5 of us, we have 9 degrees and 1 more on the way. He also imparted on us a great example and opportunity for adventure. Just like the Crosley, where he was way ahead of the times in terms of a very small car, he was also way ahead of the times in terms of a very large SUV. So he's been on both ends of the spectrum. This car took us back and forth across the country and on many other adventures. I do have to say, though, that from a public health perspective, he was a little behind the times in that seat belts were not only optional, but many times not even available in this car, as he built a bed in the back for us to lie down when we got tired, and sometimes we would enjoy the copious back space just lounging on lawn chairs. Most of his cars, especially as he progressed in all of the activism that you have also talked about today, has taught us activism. Take a stand, speak up for it, and act on it. Although I have to say that there were times, I think I speak for all of us, where we would be a little self-conscious riding around in his cars. This is his beloved boat up on the rocks after a hurricane. One of the things that he taught us is perseverance through whatever hardship that life throws at you, and leadership, how to steer a course through those trials and tribulations, both by example and then also in supporting us through many hardships and challenges in our lives. And very apropos to what he does for a living and to what you all have been talking about is health, the example that he's provided for us. The bike commuting has already been spoken about. We should have tried to find a picture of one of his old pair of running shoes, because he was quite a marathoner and ran a lot. So both a healthy lifestyle in terms of exercise and diet, but also healthy relationship. He and our mother provided such an exemplary example of what a true loving relationship can be. So now it's back to the future. Their shiny new Prius. We'll be taking them off to, given his alleged retirement, to a small coastal community in Maine, where their daughter, my sister Hannah, and Jinsuk both live. And Hannah's going to talk a little bit about what that might entail. And
I'll just close by saying that we can no longer hear him coming because the Prius is silent, except for his feet on the pea stone pathway to our house, where he frequently scoops us up for a sail or offers to take my trash to the dump or is just coming by for a walk or to say hello. And as you all see less and less of him, we're just grateful to be seeing more and more of him and have lots of opportunities to sit around that dinner table and wonder what the family of a Nobel laureate might be talking about. So thanks for sharing him with thanks for sharing him. He's pretty remarkable.
Robert Lawrence. So it's the man himself.
Well, thank you. I am overwhelmed by the generosity of comments that have been made and by the warmth and affection that I feel. I know some of you have heard me say this before, but I have to go back to my sophomore high school English class where I was wool gathering and looking around the walls, and there were quotes from famous people. And one that always riveted me was Abraham Lincoln said, "I will study and prepare myself, and maybe someday my chance will come." Well, that chance came when Al invited me to join him at Johns Hopkins. And these last 19 years have just been such a gift of extraordinary stimulation from students and colleagues and staff members, a gift of opportunity. Many of you will know Larry Green, who now is working on smoking cessation at UCSF. Larry got his PhD here in our department of health policy and management. And years later, while working at the CDC, he co-authored a book with Marshall Kreuter on the precede proceed model. And in that, he captured the concept that with behavior change, there are predisposing factors, there are enabling factors, and there are reinforcing factors. Well, the predisposing factors for my time here at Hopkins have clearly been the extraordinary strength of this school, the leadership from Al and the department chairs and other members of the dean's group. I was very fortunate. My first department chair, Don Steinwachs, a really brilliant leader, a person, a systems engineer who really understood some of the things that I was putting forward to him. Not only understood, but reinforced them and encouraged them. Followed in that department by Ellen McKenzie, and then when I shifted over, my primary appointment in environmental health sciences to John Groopman and now Marcia. So these predisposing variables, and then along came the enabling ones. The enabling ones I would be hesitant to put them in any particular order, but clearly you've seen and heard from some of the people that have worked with me in the CLF. The best hire I ever made was Polly Walker, who was returning to a professional life, and she went to see Carl Taylor, and Carl knew that I was looking for a full-time staff person to help develop the center to me, and within 20 minutes, we had agreed on her start date and what an approximate salary would be, and it was a wonderful, fortuitous, but the first of really a series of remarkable members of the CLF staff, family, graduate students, research assistants. So those have been all the enabling things. And then working out in the broader community and interacting with the kind of people that I was privileged to hear this afternoon with Jack and Len. And I think, I don't know, Jennifer, when Jack started talking about 7 people in the backyard, it was probably about a month later that you were part of that group, and you were probably out of town during that backyard soiree. But the wonderful reinforcement of colleagues, and now we have Donna McKay, the current executive director of PHR, in the audience. Thank you for being here, Donna. All of the hesitation that I must have carefully covered up, because nobody talked at all about that, all the doubts, all the uncertainties, I would interact with people like this and be immediately emboldened to carry on. So it has been very much a two-way street. And then when it comes to the Center for a Livable Future, that first phone call, Polly said was from our first donor. At the risk, I know how chary Helene is to be singled out in public, but that was such a fabulous conversation when she said, "You don't know me, but my name is Helene Lerner, and Henry Spiro shared with me the letter you faxed to him last night, and I need you to connect me with whomever it is at the school that can accept a gift of appreciated stock." It hadn't been a grant proposal. There was no budget. We'd never met. And something about the connection, I think, that Henry and I made, and you trusted Henry's judgment so deeply and profoundly. And for that, of course, I am forever grateful. Henry died prematurely of esophageal cancer 4 years after I got to know him. And I would say that in the way of forming adult relationships, people say, well, the real lasting lifelong friendships are those you make when you're in college and your college roommate, or maybe high school. I've certainly seen our children maintain close ties with high school friends. But Henry was one of these people that I felt within about a year of my interacting with him as though we had truly become close friends. And so it was with great sadness that I saw him become ill, and I was glad to be available to him for medical advice and for counsel as he lived an extraordinary life of commitment and dignity. The way forward is something that fills me with great optimism about the work that is going to be done, the continuation of the kind of thinking that Fred Kirschenman embodies, the research that Kellogg and Lance and many others who are working to define in real precision ways that make policymakers feel compelled to act. I want to just, my favorite Gandhi quote has already been used by Polly, so I'm going to move on to another one. He said, "The greatness of a nation and its moral progress can be judged by the way its animals are treated." Think about that. The greatness of a nation and its moral progress can be judged the way its animals are treated. And we are now living in a society where, except for contact with people like Fred, who know authentically what it's like to work the soil, to value living ecosystems and so forth, the vast majority of us have no sense whatever of what's going on to produce the food we eat. And indeed, that very thought was captured some time ago by Ralph Waldo Emerson. He said, "You have just dined, and however scrupulously the slaughterhouse is concealed in the graceful distance of miles, there is complicity." And one of the things that I believe we have struggled to do, we haven't done it as well as I hoped we could, and we're going to try to do better, is to really make people appreciate fully and have it a powerful motivator to bring about social change, is what Wendell Berry observes, that if you eat, you're involved in agriculture. And to somehow bring together this concept that Gandhi has about judging the moral value of a country by the way we treat our animals, with the kind of engagement that I think only would be possible for Fred's vision of a living systems approach to our food system. If we are aware of hunger around us, if we are aware of the inequitable distribution, 7 billion people living in the world today, enough food if properly distributed to feed 8 or 9 billion, and yet we have 800 million people who are stunted nutritionally and cognitively because of the failure of our current food system. So I feel in some ways as though I'm retiring from the field prematurely before the battle has been won. But I look at the wonderful young people in our school, the wonderful staff and young faculty in the Center for a Livable Future, and colleagues at Food and Water Watch, colleagues at other groups that are engaged deeply in these issues. And I feel buoyed by the optimism that indeed we have come a long way, and no longer are we being laughed at or ignored. We have won, and we're going to continue, I believe, to build upon these victories. So thank you all for being here. It's just been a fabulous time of my life, and I wouldn't trade a moment of it. Thank you.
Well, I've known Bob long enough to know the last thing you want to do is follow him up here on the podium. But I did not make up the program. I was assigned to be the last speaker. And of course, I'm also the only thing between you and the refreshments. But I wouldn't give up these couple minutes for anything in the world. So I'd like you to sit back and erase from your mind what you just heard. Everything as you just heard. Because one is, they've said everything that I was going to say. But the other thing that I'd like to point out is that, as we all know, we're all here gathered to honor a very special person. And that special person I have in mind is Cynthia Lawrence. Cynthia, would you please stand? Now, Cynthia is a very special person in her own right. And if it weren't for their shared values over a long and happy marriage, Bob could never have been the Bob that we so much admire. They are the only couple I know who underwent a grueling tax audit relatively early in their marriage because the IRS simply could not believe that anyone would give so much of their meager income to charity. So now you can guess which is the younger brother. To any young student or faculty member who has ever asked me to suggest a career path, I've inevitably recommended Yogi Berra's advice: if there's a fork in the road, take it. Bob's career is nothing if not a series of forks in the road taken, because he and Cynthia are curious and devoted to doing the right thing. As you know, Bob bleeds crimson, having attended both Harvard College and Harvard Medical School. Like his distinguished university roommates, Steve Schroeder and Tom Vernon, Bob early on decided to focus on helping to keep the disadvantaged healthy. This focus on preventive medicine was not something that his father favored. A Baptist minister who had immigrated from the impoverished Welch mining fields just as the Depression was getting underway, he had thought his son would become a wealthy Park Avenue clinician. Bob was admonished for having sat in the front pew every Sunday without ever absorbing the sermon's main message. And that was that mankind has always favored the single redeeming act, as in bypass surgery, than leading the blameless life, as in avoiding tons of high-fat beefsteaks. Some of you know Bob has had a distinguished medical career long before arriving at the Bloomberg School, pioneering preventive medicine in rural North Carolina, serving as the founding chair of primary care at Harvard Medical School and chief of medicine for 17 years at that famously dedicated community teaching hospital to Cambridge City, founding director and president of Physicians for Human Rights, chair of the U.S. Preventive Services Task Force, senior vice president for health sciences at the Rockefeller Foundation. For these, and all those have been already told to you this afternoon, for these and more, he was elected a master of the American College of Physicians in the same year as Hopkins Medicine's late Victor McCusick the father of human genetics. So that's sort of like being born into a family of a Nobel Prize winner, I think. While Bob has served, like many of us, on many boards and panels, he seems to have almost single-handedly kept the Institute of Medicine's review committees afloat. He's also the only person I know who would regularly attend annual board meetings in a place like Alberta, Canada, in the dead of winter. Bob and Cynthia's arrival at the Bloomberg School may have been, in retrospect, ordained, but it was not an obvious career move. One day I received a routine call from a mutual friend. He began with the simple news, "Did you know that Bob has decided to leave Rockefeller?" My instant response, "Really? Can I call you back in 20 minutes?" Before I returned that call, I had reached a surprised and bemused Bob, and he and Cynthia had agreed to visit, though they were quite explicit that there was little likelihood that they would relocate to Baltimore. That was 19 years ago. Bob came as the school's first dean of professional education and programs. Had he done nothing more than set the tone for that office, we would be enormously in his debt. Indeed, he always enlivened each Tuesday morning's meetings of the school's deans with what we came to dub Bob's fabulous factoids. As in, once the Chinese begin eating as much fish per capita as the Taiwanese, they will consume all the fish in the world. Or, and this is a paraphrase, or it takes 10 gallons of water to produce a single pound of butterflies. And it takes 10 pounds of butterflies to, no, he never said that, actually. I wanted to see how far I could get him going before I hit the punchline. Well, that was the only start of his many contributions to life here at the Bloomberg School. He has been, as you've heard, famously committed to students. Along with a small number of other faculty stalwarts, he helped initiate the problem-solving course, which he has taught innumerable times since. He worked with Jim Yeager, who you've just heard from, and others on the early development of our groundbreaking internet-based distance education program, amongst other initiatives. Whenever a heated, politically sensitive, and sometimes explosive issue arose amongst our impassioned students, I would insist they discuss the issue in civil and informed discourse worthy of an academic institution. And then I would send them off to Bob for tutoring and negotiation of a constructive forum. One particularly memorable occasion involved the first Intifada. Bob not only led the students through the planning of a meaningful dialogue and symposium, but recruited senior knowledgeable professionals to add their informed voices. At its end, a highly regarded Baltimore internist and Holocaust survivor came up to me and said, quote, "A discussion like that could only have taken place at this school." Along the way, and in his spare time, as you've heard, Bob, along with Scott Seeger and others, played a seminal role in organizing the trailblazing graduate training program in clinical investigation, a joint initiative with the School of Medicine from which many of Hopkins Medicine's present leaders and accomplished people like Grace Chan have graduated. And working with the book's editor, Dean Clagg, back before Dean Clagg ever contemplated becoming a dean, made major contributions to the 1,680-page Hopkins Family Health Book, a little bit thicker than the Merck Manual.
8.5 pounds.
But who's counting? You will no doubt note that this lengthy exposition of Bob's many accomplishments is yet to come to the one for which most of you probably know him best. That's the founding of the extraordinarily innovative, influential, and flourishing initiative that is the Center for a Livable Future. A unique undertaking, the CLF was crafted and has grown and mutated because of the mutual respect and hard work of many people, particularly Bob and Cynthia, faculty and students, and very importantly, the highly motivated, engaged, and philanthropically generous Elaine and Sid Lerner. Many well-meaning people understand and support causes devoted to ensuring we leave behind a sustainable world. But this was the first, and as far as I know, remains the only initiative that not only advocates for the right things, but very importantly supports the training of young professionals and scientists and conducts the research that is needed for sound, evidence-based claims, policies, and programs. Even I lost count of its growth. Not long ago, I went to visit Bob in the office he had occupied in the northeast corner of the school, the one that overlooks the Burger King that some of us are convinced was built specifically to annoy Bob. Only to discover that his office had long ago moved to the huge space that now houses the many extraordinary people and activities that comprise the Center for a Livable Future. This past summer, Jill and I visited with Bob and Cynthia in their beautiful home in Rockport, Maine. It was only then that I discovered that they considered Jill and me to be the riskier couple. Jill and I got married a few days before I began medical school. Bob and Cynthia, ever more practical, waited a full month before Bob began medical school. Jill and I were also far more profligate. Bob and Cynthia's first car, I think, of their married life, as you've seen, purchased 50 years ago, was a Volkswagen. 50 years ago, Jill and I agonized over our first car, but in the end popped for a Triumph Spitfire, a far less practical open roadster that costs $150 more. Their latest car, as you have seen, is a Prius. I'm embarrassed to tell you what ours is. I could go on, but I won't. I'm delighted that you could all join us for this marvelous tribute to Bob and Cynthia. And Bob, I'm happy to report, will still be seen regularly, if not quite so frequently, on campus. I'd like to thank all the speakers, each of whom touched upon but one discrete component of Bob's many legacies. Now, as Bob and Cynthia plan to drive off into the future, the rest of us are going to party. Thank you very much for being here.